Pre-K's Living with Elders, hosted by Age Friendly DC and the Office of the Deputy Mayor for Health and Human Services, Generations United, and Mikasa Incorporated.
Hello, this is Gail Cohn. I am bringing to you some really interesting people today with the important initiative that is in the same office with our Thrive by 5. Age Friendly is an initiative that's in the Deputy Mayor for Health and Human Services offices, intended to change DC into an easier city in which to grow older. All of us are growing older, including those who are just born. So this is an important session to talk about housing for preschoolers and children who are growing older, living with elders. And this is an opportunity to hear from speakers who really know what's going on. Donna Butts is going to lead off. She's the president and CEO of Generations United. And she will discuss national affordable intergenerational housing opportunities, including DC's Plaza West, and affordable residence reserved for elders raising children, including some who are 5 or younger. Ellen Zerbig will speak after her. Ellen is the Deputy Director of Mikasa here in DC. She will describe Genesis, an affordable residence in Northwest for moms leaving the foster care system for apartments in a building with half the units reserved for older adults, committed to helping young neighbors and their families. I want to tell you a little bit about Age Friendly DC before we go on. This is a World Health Organization initiative that has caught fire across the world, and in particular in the United States. We work together both nationally as well as internationally to share ideas about where we're headed. Each of us, however, start with what's going on in our own jurisdiction. Ellen, would you advance the slide? In DC, we found that in addition to the social determinants of health that the World Health Organization guided us toward, we had other issues that the residents wanted us to focus on. But all of us throughout the world are focused on the built environment, outdoor spaces, transportation, and housing. And then changing attitudes about growing older also includes World Health Organization focuses social participation, respect and social inclusion, civic participation and employment, and communication and information. It's in the lifelong health and security area where DC residents pointed out stuff that they wanted us to be involved with that wasn't part of the World Health Organization focus. Community support and health services was there, but not emergency preparedness and resilience. And we've all been through our dose of that with COVID-19. Then financial security is another domain where our residents in DC were concerned about whether they had enough money to make it through their lives. Public safety, our concern here expressed by the DC residents was whether they could go out any time of the day or night and feel safe. Lifelong learning is very important to all of us. We need to keep on learning throughout our lives, and we've all had a good dose of learning about technology in the last several months. And finally, caregiving, which is a really important and growing issue for us in DC, including what we're going to be talking about today. So advance the slide one more time. And I think at this point we can take this slide deck off and go to Donna Butts's slides. These are the people who are leading the age-friendly effort. Our best partner is the Center for Aging and Humanities at George Washington University, but the initiative is run by the Deputy Mayor for Health and Human Services, with Raina Smith leading it.
Well, good morning. And Gail, thank you very much for this opportunity to share a little bit about young children, and older adults living together and sharing programs together as well. It's a joy to be here with you and with Ellen. But first, I wanted to share a little bit about Generations United with you. Generations United was founded about 30 years ago. It was founded at a time when people were trying to pit the generations against each other, saying you could either support our youngest or our oldest members, but not both. And our founders came together and said, no, we can and should support our bookend generations, our generations that hold civil society together, our youngest and our oldest. And as one of our founders said, we formed Generations United to argue for a caring society. And we continue to play that role today by supporting the social compact, that give and take between generations, knowing that across our life course, we do give, we do take, and we share. And really, it also has to do with the fact that it's great to have younger and older people together, because older people know stuff you don't know, and younger people know stuff that you don't know. Intergenerational programs have historically been based on the direction of service. There are cases where older adults are serving younger people, and probably an example of that you may be most familiar with are tutoring programs, mentoring programs, things like that. There are also programs where younger people are serving older people, and I think a couple of good examples of that are teaching technology, capturing oral history, stories that would be lost if they weren't captured. And then there are times when older and younger are serving together. And that can be in the arts and humanities, where there might be an intergenerational orchestra or theater group. It can be in working together, a high school student with an older adult teaching at a grade school or elementary school child. But it's older and younger working together. Oftentimes it's in a community dialogue, an intergenerational dialogue, where young and old come together and talk about their vision for their community and how they can make it an age-friendly community, as Gail is talking about. And then the example I'm going to talk about the most today is Under One Roof, where programs either take place together or where people actually live together. And you may think that many of these have been impacted by the current pandemic, and you're right. But what we've been able to see are people who have done an amazing job of pivoting, of figuring out how to make these programs and relationships work, because they are so beneficial to young and to old. What's important is that there are benefits for young and for old. Everybody takes a bite, everybody receives. For children, the benefits are oftentimes in the personal and social skills. Young children who are around older adults learn those soft skills that they need throughout life. What's also wonderful is that their perception of older adults and people with disabilities changes. They really don't see the wheelchair, they don't see the walker, they don't see the wrinkles. They see somebody who's 70 that could be their friend as much as someone who's 7 that could be their friend. Young people who have the guidance and support of older adults do better academically, and it also supports the parents, especially when you think about these times of COVID, when people are homeschooling, when people need a break from each other, whether it's over Zoom, whatever, where older adults can help support families. For older adults, there are benefits as well. Older adults report an enhanced sense of well-being, better health, they take better care of themselves, they're more optimistic, they're more likely to have a larger social network. They look at life as having purpose and as being needed. They also talk about using canes less and also have a tendency to burn a few more calories because they're more active, they're more engaged. And I did want to mention to you, I love this photograph because the gentleman in the middle is Tom Taylor. And Tom was a wonderful, wonderful child advocate here in DC for many, many years, and actually built the first, or was responsible for the first child care center in a federal office building. Tom came out of retirement at age 80 and came to work for us at Generations United to advocate for children till he decided to retire again at 85. But I love what one shared site director said when she said, what's wonderful in the programs is that they rise to meet the expectation of the other. Meaning a child may be acting out, an older adult may be a little bit lethargic. When you put them together, they rise to meet the expectation of the other and are much more engaged and responsive. What we also know from our public polling around the country is that people want this type of opportunity. They really believe that it's a good use of resource, that we save dollars while making sense when we use facilities and programs to connect generations. We also find that about 3/4 of Americans think that by separating generations, we're really preventing older and younger people from sharing their gifts, from sharing what they have to offer with each other. And when it comes to care, we know that people, when they think about what kind of care they want or for themselves or for a loved one, they like the idea, they want the opportunity to have a care setting where older and younger people can interact. Care settings where there's an opportunity for people to engage in planned activities as well as those that happen spontaneously. Now, today I'm going to talk a little bit about grandparents raising grandchildren. Now there are about 2.7 million children that report living in households, or I guess they're adults report. They live in households that are known as grandfamilies or kinship families, where it's headed by a grandparent or another relative. And in DC, it's about 15% of the children who are reported to live with a relative who is head of the household. This is a positive because children thrive when they're in the care of relatives. And if you want more information about grand families or kinship care families, I'd encourage you to go to one of our websites, grandfamilies.org, which has a number of resources available on it. But today I want to talk a little bit about grand family housing, which we've seen develop around the country. This is Pemberton Park, which is in Kansas City. The first was in the Bronx, or the first that was built from the ground up was in the Bronx. It's been around for quite some time, and it's really paved the way for others, including Plaza West, to learn from what worked and what didn't work as they were building and as they've been servicing their families. Plaza West is a wonderful example. We love the fact that it's here in DC. We applaud the mayor. We applaud the people who are visionary, Bible Way Church and others who said, we can form a unique partnership and we can make this happen because it's the right thing to do for our families. So in Plaza West, there are 50 units that are set aside for grand families. What's important and special is that they provide supportive services on site. Everything is there, so the families don't have to try to get around in order to access all of the services. There's flexibility as the family ages, because this is one thing that's been learned, is that if a grandparent moves in with children into an apartment, that family is going to continue to age. And as the children age and perhaps age out of the family as they move on with their lives, it's important for the older caregiver to not be dislocated. So with Plaza West, there's senior housing on site that makes an easy transition for those caregivers. And I think one thing that's wonderful too has been to see the community support that there is for Plaza West. So I wanted to share a very brief NBC4 news clip with you. Sorry, now I'm having trouble getting rid of the video. Let me see what I can do. I understand that the video, let's see if we can go again. I understand that the volume was not there, and I apologize for that. Basically, what it was is it's a video that, let's see if we can get normal. There, sorry about that. The video was about food delivery at Plaza West. And what I think it illustrates, it's so important, is we've all heard about NIMBY, not in my backyard, and people not wanting families who might not be like themselves in the same area. And what is wonderful about Plaza West was that the Mount Vernon Triangle Business District embraced having the Grand Families Apartments there. And they've been very engaged in ways that they've been trying to support the families as they've been transitioning. And the families have been thrilled to be in the neighborhood because they're in the middle of a thriving area where they have access to stores, to shopping, to be able to get their groceries, things like that. And for the business district and the neighborhood residents to come out and show their support during the pandemic has been really phenomenal. So we were grateful that NBC4 covered that. And you can Google it if you would like to hear the volume. It really is a lovely story, and I'm sorry that you weren't able to hear it this time. So I wanted to move on and talk about one of the things at Generations United that we do is we issue our annual State of Grand Families report. And one, a place called Home, which we released last year, was all about affordable housing for grand families, for children and for older adults and the caregivers. And it does highlight and illustrate Plaza West here in DC. It shines a spotlight because we think it's such an excellent program. Now, the 2020 report will be actually being released in a virtual event on September 29th. And the focus of that report is on COVID and how the families are coping and what can be done to support the families during this pandemic. So if you're interested in that, I'd encourage you to go to our website to sign up for the release event or to receive a copy or a link to the report once it's released on the 29th. I briefly wanted to share a couple of other intergenerational shared site models as well. I think I've got just a couple more minutes to do that. I love this picture, by the way. This is taken at an intergenerational shared site where there's childcare at an assisted living facility. And when it came to be Halloween, this young man, when his parents said, "What would you like to be for Halloween?" He said, "Well, I want to be a grand friend, because what would be more wonderful than to be a grand friend?" So they helped him dress up so that he could look like people who he spends his days with. And he was the hit at the facility. But it would never occur to him that some people might think this was someone in need or someone he wouldn't want to interact with. To him, they were his friends. So when it comes to intergenerational shared sites in space, one is outdoors. Whenever we think about a park, a playground, an outdoor space, to design it so it can be enjoyed by people of all ages. This is San Pasqual Academy in San Diego. This was a former university that had faculty housing around it. It was in a fairly remote area in San Diego County. The county took it over, and it's now home to young people in foster care who've not had successful placements with an individual family, but are in a group care. And they then invited older adults to live in the home surrounding the school and be engaged in the young people's lives. They get reduced or free rent, and all they have to do is care about the kids and be involved, and they definitely are. And I think the example here in DC that MCASA has piloted is really a national example, a variation on this that is just really fabulous. There's also preschools or kindergarten classrooms that are run by school districts in nursing homes or care facilities. This is one in Kansas. This is Seniors on Broadway. This is a senior housing development that was built on the grounds of a playground, of a grade school, of an elementary school, and they have an intergenerational bridge that connects the two facilities. And then another intergenerational shared site model that we've looked a lot at has to do with intergenerational home sharing. And we have been convening a national collaborative of people interested in intergenerational home sharing quarterly for several years as we've been developing and learning about the models around the country. With COVID, those have gone on the back burner, but the interest is still great, and that collaboration continues to be very active. So it's as Mr. Rogers said, whether we're a preschooler or a young teen, a graduating college senior or a retired person, we human beings all want to know that we're acceptable, that our being alive somehow makes a difference in the lives of others, whether it's us, whether it's others. So I'd encourage you to join the movement, sign up for our weekly newsletter, Generations This Week. That's how you can stay up on news in the field from around the country and around the world. Participate in social media, attend our virtual intergenerational global conference in the summer of 2021. And also remember grandfamilies.org if you're interested in knowing more about grand families. Because as Albert Einstein said, remember that most people see what is and never what can be. And generations living together, working together, side by side, integrating is really what can be and what strengthens our communities and our families. So thank you.
Good morning, everyone. I'm Ellen Zerbrugg with MCASA, and it's a pleasure to be here on this panel discussion with two of my favorite organizations. We have the good fortune of doing work with Age Friendly DC and Generations United, and we're big fans of these organizations. I work with MCASA Inc. We are a community-based nonprofit affordable housing developer based in DC. We've been around for almost 30 years. We're a modest size but growing organization that began working in the early 90s when DC was losing population, hard to believe now, to facilitate first-time home ownership for low-income households who might have trouble getting mortgages or finding their first affordable home. And we started out focusing on single-family home ownership, and over the years we've expanded to cooperative ownership and then rental housing, creating affordable homes for more than 2,000 people, the majority of whom are first-generation African-American and Latino homeowners. So I'm here obviously to talk about the Genesis Intergenerational Program, which is a unique program for both MCASA and for DC, and in some ways we think around the country. MCASA founded Genesis in 2015, and this was through a very intensive and I think one of the best collaborations, public, private, and nonprofit collaborations I've ever been a part of in 20 years of doing community-based work. It was a partnership between the Child and Family Services Agency with its Office of Youth Empowerment, the DC Department of Aging and Community Living, with guidance from Generations of Hope. And if you look up Generations of Hope, they're an amazing resource for intergenerational communities throughout the country. So CFSA DC initiated the idea for the program, engaging Generations of Hope as an advisor and selecting Mikasa as developer to build the first program of its kind in DC that houses 3 generations. So young mothers aging out of foster care and their children, of course, and low-income seniors, combined with other families not affiliated with foster care, who were willing to commit volunteering time in their community. And the program's essential purpose was and remains to provide conditions for a strong sense of community to flourish, meaningful connections, and mutual support across the generations. Program staff facilitate community engagement and link residents to outside services. So unlike Plaza West, we don't have on-site services. Many of the young women who have left foster care come with outside connections to services, and many of our seniors are very connected with senior centers and other forms of support that they find outside of the building. But it's the community base that's the basis for support for the residents living at Genesis. And the long-term goals of the program are really to counteract the social isolation often experienced by low-income seniors and families, and generational economic and housing instability. So how did we fund it? Genesis was made possible through key funding and support. First, low-cost loans from the DC Department of Housing and Community Development, another public partner in the project, that funded the ground-up, fully accessible solar-powered building, and to build out 2,000 square feet of community space, including large indoor meeting space, library and computer room, small fitness center, and outdoor recreation areas, and a garden. Second, critical multi-year startup operating funding from CFSA, enabling the program to establish itself in its first years. And I'll say more about that. And third, a contract with the DC Housing Authority that provides the essential rental assistance payments to allow residents to pay 1/3 of their income on rent and to keep the building truly affordable over the years. As I mentioned, the program was formed from a groundwork of strong interagency, public, and nonprofit partnerships. The program design process lasted well over a year while the building was being built. And with guidance from Generations of Hope, lending experience gained from established intergenerational community programs around the country, in particular a founding program called Hope Meadows in Rantoul, Illinois, that some of you may know about, leadership from CFSA, and the participation of policy experts from the Center for the Study of Social Policy and Leading Age. So we had wonderful partnerships and lots of good leadership in the beginning of the program and the establishing of the program. So how does it work? The essential model for Genesis is one that promotes the idea of community and social connectedness and active participation through what we call good neighboring. This in turn supports child development, families' sense of safety and security, and reduced isolation through building strong and really anticipated long-term relationships. So Genesis is anticipated to be permanent housing. People do move on from time to time, but they can remain in place as long as they wish to. So this also provides security for many seniors who are aging in place, and many of whom do not have close families. So they have this sense as they age in place that they will not be alone. There are other examples that Donna shared of intergenerational communities in DC, Plaza West, and in other parts of the country, and certainly in the world. Genesis is one of the few that we know of to house young mothers who have aged out of the foster care system. So just an overview of who lives at Genesis. There are 27 households, the majority of which are made up of people of color, African American, African immigrants, and Latino immigrants. The majority of households are women-headed. And for young mothers who have aged out, children's ages range from about 2 years old to 11. For other families, the range is between 5 years old and high school age. And in a few cases, we have older children who are in college and return home in the summertime and are actually really great participants in the community. On average, seniors are on the younger side. So I would say, entering the program in their earlier mid-60s, and we do have our eldest, everybody's grandmother, who's age 92. Before Genesis opened, the resident selection process lasted more than 5 or 6 months of outreach, referrals, reference checks, and multiple in-depth interviews by committee. I think many of the residents felt they'd never been through such an intensive process, but to hear from them describe the ways in which they would actively participate in the community. So the essential program objectives are community building, resident capacity building, and leadership development. And then a fourth goal, if you will, is program sustainability and just the challenge of maintaining operating funding year after year. So the community commitment is the essential part of good neighboring, which is the participation that residents provide to one another in formal and informal ways. So many ways to participate. People sign up for an ongoing task or event, or people commit to spending time with one another in more informal ways. When we opened up Genesis initially, we based the community participation model on Generations of Hope, which was much more of an hours-based community participation model. And then after discussions with the community who felt like the system was too rigid and didn't capture all the little things that happened organically between neighbors, the staff and the residents worked to redesign the program in 2019. And the result was the Good Neighboring Initiative, which tracks participation not by hours, but by tasks. And that's, again, how people sign up and report monthly on the ways in which they're supporting each other. So 3 kinds of support. In general, one-on-one support is given, like a neighbor gives another neighbor a ride to work or picks up groceries. These things are more and more important during COVID-19, and they're happening actually more frequently, I would say, during COVID-19 because of the need. Reading to or spending time with a child or helping with homework, or even older adults spending time with a mom who's working on a resume or needs to write something to apply for a job. And then there's general community support, like organizing the library or the community room, designing or disseminating flyers, working on a newsletter. And we have one resident who every night goes to check and make sure that all the doors are locked so everyone feels secure. You can count on her for that. And then the other way to be involved is organizing a class or a one-time event. Things like we've had elders teach Spanish classes, organize a garden club, being part of organizing a third Tuesday dinner or an open mic night. So these are just some examples of resident-led activities. We've also had third-party organizations participate in programming, such as arts organizations. So elders and young people come together for shared experiences through intergenerational arts and music programming, which also serves to expose children to arts programming that they might be missing in school. And then some specific on-request learning sessions, such as we had a cohort of called Pathways to Homeownership last fall for interested first-time homeowners. One of the challenges right now, obviously, is the need for social distance for public health and safety. And the Genesis program is developing a new plan to focus more heavily on supporting resident leadership and resident-led programming with a focus on small-scale connections between neighbors rather than large gatherings. And we've worked hard to try to make sure that people are connected in different ways. One of the best things that happened this summer was we had a gardening program that initiated and was held mostly out of doors, so people felt comfortable social distancing. But there have been many challenges in terms of getting people online for events and online to connect with one another. Some things do continue to happen between individual neighbors, but not as much, obviously, in groups during COVID-19. And I think one of our greatest challenges has been capturing outcomes long-term. We're a relatively new program. It's 5 years old. Fortunately, we did plan early to begin collecting data from residents through in-depth entrance surveys and annual surveys to track outcomes. So some of the outcomes we've tracked are people's sense of connection with their neighbors. One of the most important things, happy to report that everyone surveyed said that they have a good connection with their neighbors. The majority said that they have one or more strong friendships with neighbors. And all residents report feeling safe in their home, which is up from around 80% when people entered the program. Young mothers are all pursuing education or have stable employment, and all families exiting the foster care system have remained intact. And more intangible, difficult to capture data, the children in the community are really thriving. And this is observed by the sense of security and confidence they convey, their easy connection with elders who, under normal circumstances, would reach out to envelop them in a big hug as they tumble into the community room after school, or sit next to them during quilt making, or help them to learn to sew, or play a game during community dinners. And I just want to end on saying that one of the biggest challenges the program still faces, being both relatively new and non-traditional, is sustained funding. CFSA continues to support the program, but it's limited by its own funding restrictions. And while we found there's a lot of interest in the program, many established funders will only commit for a single year or in small increments. So we're once again in the process of retooling the program, changing staff, and adapting to social distancing and better facilitating community-led programming. We remain hopeful because we've observed that the real power lies in the hands of the residents themselves, the young mothers, their children, and the seniors who've built strong relationships and a strong sense of caring across the generations, and continue to demonstrate resilience and initiative, even as they strive to survive and thrive in their own lives. If you want to find out more information on Genesis, here are some of the websites and highlights and links to our website as well, mikasa-inc.org. And thank you.
Hi, we have some questions. This is Gail Cohn again, wanting to respond to our audience. And we have some questions from Kirsten. How can grandparents feel supported and validated when supporting early learners, especially now with virtual classrooms as the norm?
I can take a first stab at that, and then Ellen, you may have some ideas as well with the residents that you work with. But there are a few things that in terms of working with grandparents who are raising grandchildren, what we know is extremely helpful are support groups. And many support groups have gone virtual. Virtual may be as low tech as a phone call or a conference call. It could be Zooms, it can be other ways, but those support groups where they're able to talk with their peers and share how things are going, lessons learned, look for guidance and advice is just extremely helpful. It's also, I think, really important for us. I've talked with many grandparents over the years who just say what we really need is respect for what we're doing. And I think we can all show that and show our support and appreciation, because the grandparents have made a number of sacrifices. I've never met one who said they wouldn't do it for their grandchild, but we know that they've put their own lives on hold. And so what we found is really, really helpful also is we have a network called Grand Voices, and we do have several Grand Voices here in DC. And these are people that we've worked with to tell their stories to policymakers, to city councils, to organizations, to make sure that people understand the circumstances and are keeping them in mind when they're designing policy and services. So it's really listening and engaging and valuing and affirming that I think are very helpful.
Another question, how can grandparents feel supported and validated when supporting early learners, especially now? That's the question I just put before you. How do you make sure that adult caregivers are all on the same page with expectations for kids? Great question.
Well, in terms of adult caregivers, when they're not on the same page, I think this gets into something that we're seeing in particular in the area during this era of COVID and the pandemic. And that is that Pew reported that over 50% of the adults that moved as a result of COVID have moved back in with family members. So we're seeing a tremendous increase in multi-generational households. Now, those are different than skip generation households or grand family households. Those are households that generally have 3 or more generations in them. And oftentimes what we always recommend is communication is essential. If it's at all possible, you know you're going to be living together, what you need to do is sit down and be very clear about expectations. And one of those expectations is how the children are going to be raised and who's going to be the lead in that. It's also an important conversation when an older relative is providing childcare. Now, there is a role that grandparents often play. One of my favorite quotes was from Marion Robinson, who was Michelle Obama's mother and moved into the White House with them, which helped the Obamas to be able to really perform their duties, knowing they had that backup for their daughters. But she was the first one to say that she could discipline the girls, but she would also be the first one to give them ice cream. So there are things that grandparents are going to do, and it's coming up with what you can all live with.
Here's one for you, Ellen. What are the requirements that senior citizens must meet to qualify for acceptance in grand families and Genesis? Are there age and health requirements?
That's a great question. So most important, most essential was their ability to articulate in their application, and particularly in in-person interviews, how they would specifically engage with community members, what they hope to bring, why they hope to be part of a community. And some experience, it doesn't have to be formal experience. For many people, it was, growing up in Nigeria and having an experience there where they organically had a sense of community with elders, and, organically, their families expected them to volunteer in the community and be part of the community. Or, someone who grew up in DC who was a community leader and, really enjoyed that sense of volunteerism. So just, in some way able to articulate strongly and with heart how you would participate in the community. There are not age or any other criteria, health criteria, certainly for participating in the program. We have, had people enter the program, seniors who, had physical constraints, and, we're able to work with them with support from, usually an aid worker or a visiting nurse. We are a little limited in terms of, even though the building is fully accessible, there is not on-site nursing. And so we have had two elder residents leave when they determined that they were at a point where they needed more support, and they moved to one to an assisted living facility and the other to a community that had built-in health care services. And so that does sometimes happen. But the wonderful thing is that the community worked with them on this transition and, gave them a send-off, and, there still is connection. They will come back and visit the community, and there still is connection with the relationships that they built. So.
And now back to you, Donna. Here's a question. How do you transition from grandparent care to early education preschool?
Interesting question. I'm not quite sure if the questioner is talking about, grandparents are stepping up. They're providing childcare, oftentimes at risk to themselves during this time of COVID, because childcare has been difficult to access. And as schools are reopening, in some areas, they are transitioning back to other care. If a grandparent is raising a child, they have, and they are responsible for that child, they have the access and ability to access education for their grandchild and to access their individual education plan. And so it's really important that they know when the child is transitioning from their home to school, that they have the rights that parents have in terms of talking to teachers, accessing the supports and services that their child needs. So I did want to mention one other thing. Since Ellen mentioned a gentleman from Nigeria at Genesis, I had the good fortune when Genesis first opened to go up, and everyone was so gracious and generous and let us shoot a video there that we were involved with at the time. And one of the video clips that we got that looks different than it actually was when an older gentleman, who I believe is the gentleman from Nigeria, who was incredibly charming, was with a teenager in the computer lab. And on video, it looks like the teenager is teaching him how to use something on the computer, when in fact he was educating the teenager about a new program he had just been learning. And I thought it was such a wonderful example of that reciprocity between generations, and that people at every age have something to give and are gifts. So I just wanted to add that.
That's great. I want to add this question because it's a transition back to the opportunity we have, because we have some time, to see the NBC4 strip again, the piece that you presented earlier in which we couldn't hear. The question is, how can the general community support our elder population, especially those raising grandchildren? And I would take this not only with Plaza West and where people are together, but across the city, because we have people living throughout the community who are raising grandchildren in homes. And you point out, both of you, that there are people living with multi-generational families. So I think this question is an important one. How can one provide support to those individuals as community support, as they provide parenting?
Well, I do think that one of the things I like about the video that I do hope you're able to see is that it shows community involvement. Sometimes it's something very, very simple. If you grow extra vegetables, you deliver those. You check in. You'd make a phone call. You find out, do you need somebody to pick up your prescription? Especially when the pandemic began, many of the grandparents we spoke with were simply terrified, because they knew if they got sick, their children would go into the foster care system. They'd lose those children because they don't have a backup plan. So in fact, anything that people can do to make it easier. I think one of the stories that always stood out to me too was an older grandfather who was helping. He and his wife were raising their two grandchildren, and it was time for one of the grandchildren to take the training wheels off the little tricycle he had been learning on. And he said it was one thing when I was younger and I was a father to be able to push that bike along without the training wheels till he could balance. But now it's really hard. And so the role that Big Brothers, Big Sisters, that Boys and Girls Clubs, that mentors, that sororities, fraternities, people of all age can play so that the children have an opportunity to run and play sports and do things they might not be able to, and give the grandparents respite is also really important. But I think the other part of this question, and I think Gail and Ellen in the work that and the passion they have for the work that they do share this, which is oftentimes it's the older adults who are the givers of care, who are the givers of support. And so we can think about supporting older adults, which we need to do. But let's also think about how we engage older adults in supporting families, in supporting the residents, the young women and residents at Genesis, at other facilities, because older adults have so much to give, so much to contribute. Let's make sure that we're not making them or letting them sit on the sidelines. We need them.
So here's our final question, and then we'll watch the video again. Are there mental health benefits for grandparents when they live in multi-generational homes? The questioner says, I love the idea it takes a village to raise a child, but I think there are benefits to the whole village. Certainly a good comment. And we all agree on that one on this panel, no question about it. One comment before one of you takes on the mental health issue of how that support is provided. We know that it was great fun having the fire department come to Genesis, who are nearby and didn't realize Genesis was there, and got to know the community as a result of that. And I hope that relationship continued after we were there together.
I'm glad you brought that up, Gail, because that was a wonderful connection that Age Friendly DC helped to establish. The fire department has a new building right almost directly across the street from Genesis. Genesis is located also near the newly developing Walter Reed development. So it's not as central as Plaza West, but, walking distance to the Tacoma Metro. And there are connections that we've been able to make with local schools, for example, and the fire department that I think are really wonderful, and hope to nurture those going forward. And one example of, it takes a village, and for senior support, I think is very important. We have an elder who's one of the more fragile elders in the community, who is very private. And I think, people try to look in on her, but they're also very respectful of her privacy. But, at one point recently, she was struggling a bit, and she had her smoke detector go off. It was nothing serious. It was just she left something on and she wasn't feeling well. She was in the other room. And it was amazing how the community came together and rallied around her. The fire department came, they were all there, but it was community members who came and supported her, brought her a chair, brought her a glass of water. She was sitting outside, and the fire department was checking her apartment. And, actually people communicated with me these wonderful pictures of people just surrounding her with care and with concern. And so, I think definitely those connections, the sense that you're not alone, the sense that, people will look after you when something like that happens, is an invaluable sense of security and wonderful sense of, that I'm somewhere that I not only give, but I'm receiving on a regular basis from the village. And I do think that is exactly right, that the whole village benefits, that people feel good, that they're able to contribute and support one another, and respect one another, and really learn to love one another.
So I think we should take the time now to go ahead and watch the video again. I really am looking forward to it. Thank you so much for allowing us to do this presentation. I hope those who are watching have other questions that they will certainly bring to the attention of both Ellen and Donna and me. We're all interested in hearing from you. So let's watch the video again.
Many of us take for granted the ability to be able to just head to the grocery store. Not all seniors can do that right now. That's why a DC organization is stepping up to help some grandparents caring for their grandchildren. They're the ones getting the food so that they're not exposed during this pandemic. A helping hand
There's
for
no
a
sound
special
on this
group of
end.
seniors in Northwest DC.
We saw a tremendous need here at Plaza West, given the unique population
Yeah, I think
that lives here.
we should give this up because I think it's an opportunity for us to
It's home to dozens
hear
of grand
from
families,
Donna
grandparents who,
about
for
the
one reason
mental
or another,
health
are
support.
raising their
I know
grandchildren. Olivia
from
Chase is one of
speaking
them.
with people at Plaza West that the grandparents who live there with their children have either lost their own children and have taken over because they've died, or they are incapacitated by some very challenging event, or they're in jail. And those individuals need to work through some of those feelings that they have that thrust upon them, I'll say it that way, just to spin it, being the parent again.
I think Ellen addressed the mental health aspect of multi-generational families really, really well in terms of the benefits. Gail, when we think about Plaza West, in particular, and grand families, you're right. Grandparents do well raising grandchildren. The children do thrive, but only if they're supported, because the grandparents are dealing with loss, the children are dealing with loss, the children are more likely to have special needs, both physical and emotional, and the grandparents are really grieving the loss of what they thought their later years might be. So it's really important to provide respite, to provide mental health services. But what you'll also hear from grandparents, as Ellen was describing, is that sense of purpose. I need to get out of bed. I need to take better care of myself because I want a better life for my grandchild. And in a multi-generational family, there are incredible benefits because, one, the middle generation doesn't have to worry about their parents being secluded and socially isolated, especially during a time of COVID. And they have that extra pair of hands, extra set of wheels to help with the children. And the children have a sense of roots. It's a win-win-win. And as a society, we need to stop thinking of a multi-generational family as a deficit model, as a sad situation, when in fact it can be incredibly strong and incredibly helpful for our families and our communities. So thank you.
Very, very fun working with you. I always enjoy seeing you and hearing what you have to say. We all learn from one another, and it's a pleasure. Enjoy the rest of the Thrive by 5 conference. It's a wonderful opportunity for all of us to learn. Goodbye.
Thank you so much.
There is a major crisis with America's health system. Millions of people, including many with health insurance, are unable to get the care they need. The solution is simple. Having access to reliable, high-quality healthcare is the way to keep people and communities healthy.
That is why 30 years ago, we created Mary Center, because we believe that everyone should have access to the best possible healthcare, regardless of their ability to pay. For us, quality care is not a service, it's a human right.
For Mary Center, quality care goes beyond just medical care. It includes access to the very best in dental, behavioral health services, low-cost pharmaceuticals, education, and social services. We believe healthy people make healthier communities. So we've decided to refresh our look to show that by connecting each person to the best possible care, we will not only improve lives, but we will strengthen communities too, one person at a time. When Mary Center puts care at the core, you can too. To schedule an appointment or find out how you can help, visit our centers or go online at marycenter.org.
This is a vaccination to keep you healthy. You don't want the measles, do you? Here's your sticker.
Protect your loved ones and they'll pass it on. Don't let COVID-19 stop you from protecting your child.
You're next, Mr. Bear. You need a flu shot.
Now more than ever, it's important your child receives their vaccines on time. Brought to you by the District of Columbia Department of Health.
Ah, good. See, it wasn't that bad.
Do you worry your preschooler doesn't walk, talk, draw, or play like other children their age? The Early Stages Center can help. Our friendly staff will assess your child's development through one-on-one, play-based activities. Early Stages will then connect your family with the educational services that are right for you. Everything is free, whether your child is in public school, private school, or not yet enrolled in school. Call 202-698-8037, a service of the DC Public Schools.
This is a total no judgment zone. We don't want parents to feel like because of X decision that they've made that they've done something the wrong way, because I know how sometimes difficult it is to manage diet and brushing. So it's important to put families at ease, encourage instead of discouraging, and making sure that they know that we are partners in their care, and not those that are there just to wag a finger or judge them about anything that they're doing. To get a call from a parent that says, I can now breastfeed my child because of you. Maybe they've been told elsewhere they'll never breastfeed their kid, and a simple procedure to do something now changes that whole trajectory for them. Or a child that may have been referred to me and no one can do anything with them, and they come in and I'm going, really? The kid walked in and out smiling, like we had a ball. And we didn't have to do anything like sedation or general anesthesia, which we do pretty often, for them. We didn't even have to do that. A simple, just encouraging, it's gonna be okay, we got this, we're gonna do it together, let me know what you need. Just kind of thinking about families and thinking about my own family as we make decisions within our practice.
Listen, every day in America, workers are forced to make the unthinkable choice between caring for themselves and loved ones or keeping their job. You know how that can be. Beginning July 1st, 2020, workers in the District of Columbia will be eligible for paid family leave. That's right. When your loved ones need you most, you should be able to step up to the plate and take care of them. That's why DC Paid Family Leave will provide up to 8 weeks of parental leave to bond with a new child, 6 weeks of family leave to care for a sick family member, and 2 weeks of medical leave to care for yourself when facing a serious health condition. Hey, we understand that sometimes life happens, and you shouldn't have to choose between your livelihood and your loved ones. So if you want to learn more about DC Paid Family Leave, check it out at dcpaidfamilyleave.dc.gov.
Complete the 2020 U.S. Census. It is safe and secure. It benefits your city, your community, and your family. When you fill it out, you will help determine where billions of dollars will go, funding our kids' education, school breakfast and lunches, healthcare and Medicaid for our seniors, better social services, creating more affordable housing, job training, and helping everyone have access to food. Complete the census online, over the phone, or once you receive it in the mail. You matter. Get counted. 2020census.gov.
we've been able to really shift our care according to what we feel like the population needs. I think one of the things that makes us strong is that we provide culturally aware care. I think it helps that the majority of our midwives are of color. When we're talking about birth disparities, especially with African American women, I think that we are now entertaining the conversation about years of generational distrust with a lot of healthcare systems. And so I think that we create a safe space for that interaction, not only by having more staff of color, but also just things like our late policy. Midwives, we see our patients regardless if they're late. We see pregnant patients late and we see babies late.
Our whole family is just tied up into Community of Hope.
Hi, I'm Heidi Murkoff, author of What to Expect When You're Expecting, and you may have heard moms matter to me a lot. That's why I founded the What to Expect Project and why I'm here to support Mayor Bowser's National Maternal and Infant Health Summit, because every mom should matter. I always say motherhood is the ultimate sisterhood, that no matter where she lives, her cultural, socioeconomic, political profile, the color of her skin, every mom shares a common goal. Every mom wants the best for herself and her baby. But far too many moms, especially Black moms, don't receive the quality, respectful prenatal care they need and deserve. Too many Black moms die of complications of pregnancy and childbirth, and far too many of those deaths are preventable. And the onset of COVID-19 has increased the risks for Black moms. Gaps are widening as clinics and hospitals in rural and urban areas close, and care becomes even less accessible. And more of our most vulnerable moms I speak to every day, are falling through the cracks of care. The truth is we can take care of our moms and control pandemic at the same time. We just have to pick our healthcare priorities, and we have to stop always putting Black moms last, like they don't even matter. One way we can do that by voting. This year, WhatToExpect.com, a home to over 19.6 million moms, and the What to Expect Project have launched #MomTheVote to urge moms to speak up and be heard, to vote for those who vote for them, for maternal health care that doesn't discriminate or come with a use-by date, and that isn't paused because of a pandemic, for paid family leave that allows moms to care for themselves and their babies instead of forcing them back to work after only a week or two, affordable childcare, and so many other policies that impact their lives and their children's futures and that of their mom sisters. There's no better investment in our future than the health and well-being of our moms. All of our moms, no exceptions, no disparities. Let's stop failing our moms. Let's make moms the priority they should be.
I'm Polly Donaldson, Director of DC's Department of Housing and Community Development. and I wanted to talk about affordable housing in the District of Columbia and our affordability crisis. The rule of thumb is you should only spend about a third of your income on your housing needs. We know we have to do more in the District of Columbia.
Mayor Bowser has been a national leader in affordable housing policies and funding, but she realizes we need to do more. So she challenged the city to produce 36,000 housing units by 2025, with 12,000 affordable to low-income residents. Our first analysis is looking at where affordable housing is across the city and where it should be in the future. This summer, we asked residents to examine a map of affordable housing in the city.
I feel the distribution of affordable housing in the city could be a lot better. It seems too much of it is concentrated east of the river in Ward 7 and 8, and not enough of it in Ward 3. Ward 3 would be a perfect place to have more affordable housing. It's resource rich.
For me, housing and affordable housing is personal. I first got involved in producing affordable housing for our homeless families over 30 years ago. To me, it's all about who is your neighbor, and are we able to say that anybody who wants to be in the district, whether you've been here for 5 generations or for 5 minutes, there is a place for you in the District of Columbia.
Clara is our first child, and we didn't know what to expect being first-time parents. And it's just been such a fun experience to watch her grow. Starting out very early, we monitored Clara's development using the Learn the Signs Act Early checklist. It was just an amazing resource to be able to say, okay, this is what she should be doing at this age. And it calmed our fears a little bit.
I would have to say my favorite resource of the Learn the Signs Act Early would be the app. But having the app readily available has honestly been great. And it's been awesome just seeing her development and growth. The Learn the Signs Act Early app is actually very easy to use. I can access it right there on my phone. And whenever my mind kind of pops to it, I can open it up.
I think I am a Learn the Signs Act Early super user. The Learn the Signs Act Early materials have been invaluable to me because I feel like they've been there with me throughout parenthood in kind of the way that a wise old friend might be.
Using Learn the Signs Act Early has helped me monitor my daughter's development and gives me a great peace of mind that the information is accurate and it's backed by science. It's fun to see when she achieves a milestone. I feel very proud for her and excited.
And it's not just a milestone of, is my child doing this next thing? It's what should I be working with my child next? Because that can be a big question mark as a first-time parent.
I want to know if maybe she's lagging farther behind than she really should, and that's something to bring up with our pediatrician.
Having something at my fingertips to kind of go through it with her physician. She's hitting these milestones, but not these other milestones. Should I be concerned? What kinds of things can I do to bring her up to speed? And then taking that and translating it with her teachers in her classroom to make sure these are the things I would like to focus on, and how can we work together to make sure that she's developing appropriately.
The Learn the Signs Act Early resources empower parents to take a stake in tracking their child's developmental milestones.
Sister Friends, It Takes a Village, hosted by Latoya Archibald.
All right, good morning, everyone, and welcome to Sister Friends, It Takes a Village. My name is Latoya Archibald. I'm a Ward 7 resident in Deanwood, Washington, D.C., and I'm also the founder and chief doula with the DC Doula. And I just want to thank Mayor Bowser, the Thrive team, everyone working to support the sound, and AV, who's worked so diligently to make this summit happen. Maternal and infant health is super important, and I'm grateful to be invited to hold space here. So thank you so much for joining us this morning. I moved to Washington, D.C. about 17 years ago to attend Howard University. It was there that I met my first group of chosen sister friends. These are women from all over the country who care for me, who challenge me, who cheer for me, who check me, who choose me. And time again, we've seen each other through partnerships, through businesses, through pregnancies, through relationships, through situationships, through tragic loss, and huge wins. Specifically, when it comes to maternal and infant health, these are women, some women that I've been able to walk through as their doula. These are women that I've just walked through to hold their hand as they are trying to decide whether or not they want to have kids. These are women who, similar to me, are not partnered or not married and are trying to decide if that's something that we really want. And then sort of like know that that's something that we really want and being honest and have these honest conversations with each other about these things. And so it has just been so refreshing, so magical, so necessary to have sister-friend relationships. I don't know where I would be without them. And as I think about what we're experiencing now with COVID-19 and the racial revolution that's going on out in the world, specifically in the United States, it's been so refreshing, so mandatory to have strong relationships with women in my life. And so today, I want to introduce you to some of the women who have made a difference in my life, women who I consider sister friends, women who have chosen me, and I continue to choose them too. And so I kind of want to give you a chance to meet them, and I want them to share a little bit about their journey. And I'm going to introduce them, I'll have them introduce themselves in the order of the amount of time that I've known them. So I'm going to start off with Brittany.
Hi, everyone. Thank you so much, LaToya. My name is Brittany Young. I am a middle school learning specialist at the Norwood School. And so my mommy journey, I was thrust into motherhood, really. I married a DC native in 2011. And then during our first year of marriage, he's also in the DC Army National Guard. And for our first year of marriage, he went off to Afghanistan. And so he was gone for a year. And then when he returned, we eventually got pregnant with our first child, who's now 7, Aaron Jr. Then when Aaron Jr. he was 6 months old, we found out that we were also going to have twins. And so that was a lot.
Yeah.
It was scary. I went to counseling because I was grieving the fact that I wasn't going to, bounce back and snap back and, gain myself again. And then when we had twins, we moved to California to move in with my parents so we could get help with our 3 babies, because we had 3 babies. And while in California, although I was so grateful to have my mom and dad's help, it was really hard not being with my sister friends, the ones that had kids and those that didn't have kids. My sister friends, I've realized while in California, not having my circle, that my sister friends are the people that remind me that I am more than a mom. And so that's a little bit about me, my mommy journey, and the importance of my sister circle.
Thanks, Brittany. Next we'll have Courtney.
Hi, my name is Courtney Douglas, and among other things, I'm a PhD student, I'm an educator, also a birth worker, I'm a huge Golden Girls fan, as well as a hopeful parent. So I'm originally from Tallahassee, Florida, but I've been in DC about 13 years now. And, when people ask me, like, oh, what's it like? I always say that it feels like home. And so I kind of journeyed here on my own, independently, kind of trying to pursue school or career. And what's really made it like my home and like my city has been community. And I think I really have just benefited from the relationships with women that have really poured into me, just kind of throughout my time here. And even kind of looking back at my journey, it's been really just an honor, I think, as my roots have kind of grown deeper here, to be able to be that sort of like family to other women in the area. And so along my journey to motherhood, I've had some, I guess you could call them speed bumps. And so one of those being that, at 35, I thought I'd already be married with children by now. I'm currently very single. And so in addition to that, I have a PCOS diagnosis, and a couple years ago, actually had to have an emergency surgery to have one of my ovaries removed. So through that experience, I've just sort of experienced a lot of questions and grieving and frustrations, and it's been necessary on my journey to have that space with other women who allow me to sort of like ask these crazy questions now that I'm sort of thinking through in terms of, what does it mean to start a non-traditional family, or how do I reconcile like my faith with not being sure how I feel about, what does God think about sperm donors, and, what would it be to choose to be a single mom? And so I think even right now, as I sort of like wrestle through those things, and I don't necessarily have answers, but, as a birth worker, have been able to witness, what it is to see the birth of a mother, or even just childbirth in general. It's like, I know 1,000% that I want that for myself. And even though today I don't know what it's going to look like, I'm really thankful for the women who I know are going to be part of my life and part of my support team once I do figure that out.
Thank you, Courtney. Next we have Malika.
Thank you, Latoya, and hello, everyone. So I am Malika Fair. I have been in DC for 11 years. I came here primarily for a job. I'm an emergency physician, so my first job out of residency is at GW, and I'm still on faculty there. I also work at the Association of American Medical Colleges as a senior director of health equity partnerships and programs. So when I got to DC, even though I was here professionally and I had a lot of friends from college, it really wasn't until 2015 where DC felt like home. So I got married, and we moved to a wonderful neighborhood in Ward 7 called Hillcrest. And that's where I felt that I was supposed to be here. Everything was working out the way I hoped it was going to. And I was excited to begin this journey towards motherhood. And so I envisioned being able to raise a family with my husband in Hillcrest and have the support of my neighbors, my friends, my family who are all across the country. And things didn't quite work out according to my plan. So I had a really long journey of infertility and ended up doing multiple rounds of IVF. And along my journey to motherhood, so I did become a mother, thank God, last November to a wonderful baby girl. But along that pathway, my husband suddenly passed away of a heart attack. And this totally derailed my life and my plans. And I thought it derailed my life and my plan, but God had other plans. And I'm really glad that He's brought me to this place of being a mother, and all the things that I thought I needed to be a mom, He provided. And so that includes, a wonderful family and the sister friends that I have both here in DC, across the nation, including Latoya, who served as my doula and helping to raise Kira with me, especially during the pandemic. So it's just been quite a journey that I wouldn't want anyone to follow my exact path, because there was some really, really significant lows, but the highs have been amazing, and I'm just so grateful.
Thank you. And Cherie.
Well, Latoya, first, thank you for just putting all this together, connecting us, and I feel really privileged to just get to connect with these other women. I'm Cherie, and I am actually at the end of homeschooling. I homeschool two girls. One's through college, one's just going into college. So that's what I've been doing for the last 17 years, along with little bits and pieces of this and that. Prior to that, I was in international development where I worked for USAID and then ran the AME Churches Development Agency. But most recently, just the joy of hanging out with my girls and my other my godchildren and my nieces. So I can truly say that the women in my life have been lifelines. My mom, my aunties, my friends, and my sisters. They have been the ones that have enabled me, I want to say, to nurture my girls and to love them well. I have two daughters, as I said. I moved to DC 28 years ago when I got married to Lorenzo. We were both had moved around a lot growing up. His dad was foreign service, my dad was military. So we were really excited about planting ourselves and figuring out what does it feel like and what does it mean to establish roots in a community. And that was something we wanted to give our family. And so maybe 5 years into our marriage, we thought, all right, we're ready to start a family. And, when you think you're ready to do something, Malika, much like what you just said, you just think it's going to happen. Not so with me. I did get pregnant, but I kept having miscarriages. I had several miscarriages prior to having my first daughter, Jordan, who was 2 months premature. And that was after 5 months of bed rest in order to do that. And both girls required bed rest. And I can tell you that if it weren't for my sister Chantel and my dearest friend Pam, who moved down the street from me and who was an ER physician, so she really understood what was going on with my body and really was on top of me to stay in bed and do all the things. I don't know what would have happened. I mean, I can't imagine life without these women in my life, and they have been with me through the grieving. They have been with me through the anxiety, their words of wisdom, counsel, support, all the things that you count on through the joys have just, again, I don't even want to think about not having them in my life. And so I'll just leave it at there so we can get into our conversation, which I can't wait.
Thank you, Cherie, and thank all of you. I'm super excited for this talk. So I'm gonna relax my shoulders.
Yeah, relax.
I don't have my Spanx on because y'all don't have to see the bottom half of what I got going on. So I'm ready to chat it up. So okay. All right. So, Brittany, pre-mommy journey, what was your view on close female relationships? Like, what'd you think?
Yeah, I've always been a girl's girl. Like, I'm so grateful that God brought me to Howard and that, I ended up having a crew of women and like that, we could lean on each other, cry with each other, laugh, yeah, so that's my answer to that. Like, mommy, like, I was down with the homies.
I'll add too that I've always been a girl's girl, and I'm very fortunate to have biological sisters. I have two sisters, an older sister and a younger sister, and I don't use the term sister-in-law. I have a sister-in-love, and so having three sisters in my life set the bar for any of my other female friendships throughout my life, and of course having a wonderful mom too. And I think that I value my biological relationships, but that it gives me a window in terms of these other relationships that I have to say, this is what it feels like to have a sister, and this is how to build this community of women. Yeah. And I've just been able to be very fortunate to have this community all over the country.
Yeah. Yeah, I would agree too, Malika. I'm one of four, and I'm the oldest girl, and then we're 4 girls. And then my dad had 5 sisters, so this man was just surrounded by women. But you're right, just the connection to women, it was always there. And then I think also growing up, watching my mom, we're a military family, and watching how the women connected really well and kind of quickly to support one another in the different, all the things that they had to do. So I saw that and I valued it, and it was always something that was very important to me.
Yeah, I'm one of five girls and one boy, and my sisters are some of my best friends now. I love it, and I think I was like, oh, I want to have guy friends, but I just know that I wouldn't be able to share with them in the way that I have been, with my girlfriends, with my sister friends. I'm grateful for the men in my life, but I couldn't do it without the ladies. So very similar.
Yeah.
I think for me, I'm highly introverted, and have felt sort of independent for most of my life. And I think I can kind of have this idea that I'm like, oh, I'm good. I'll just do my own thing. And then when I look back, I'm like, oh my gosh, there's always been just circles of women that at just different points in my life are usually kind of connected to a specific purpose that then just blossom into, these just really meaningful and long-lasting relationships that why did I think that I was just out here doing stuff on my own? I need
Yeah. Yeah. I'm glad to have you around, Courtney. Thank you for sticking it out. I'm grateful. So, Malika, how have relationships with women positively impacted your motherhood journey? What's that look like?
So, my motherhood journey was complicated by grieving at the same time, both grieving my husband as a partner, but also as the father of my daughter. So I had to kind of reset what that was going to look like. And my sister friends helped me to continue that journey and enjoy it when my body and my mind wasn't always there. Mm-hmm. And so they would make sure that I was still getting my hair done, and they would drive me and take me out to dinner, and they'd make sure I have my spa days and just things that I would have just sat around the house for 9 months, but they made sure that I was well taken care of. And when I didn't even want any celebrations, I didn't want a shower, I didn't want anything, and they continued to find creative ways, very creative, to celebrate me anyway. And I'm so grateful. One of the things that I didn't even anticipate was I wanted to spend my maternity leave back in Michigan with my family. And so I figured, I'm a traveler, so I know how to pack up and go anywhere in a minute's notice, but completely different when you have a child. But my friends in Michigan anticipated exactly what I was going to need there and set up the entire room for me. And I wouldn't have known to ask. I didn't even know I needed that. But they just showed up for me, and I'm just super grateful.
That's beautiful.
That's so spot on what you said about when your body and your mind aren't there, your sister friends are the ones that come in and just provide you with what you need, help you be present, snap you back to reality. I just remember with LaToya going to California at 35 weeks pregnant with twins and the little baby, because my husband couldn't come with us, and we were getting on a plane, and I just was still in shock that I still had to move to California because I didn't initially want to go. But it was having LaToya there with me, since I didn't have my partner with me. I had my girl with me to just help me take each step, get on the plane, sit down, let me take AJ. So yes, when your body and mind aren't there, it's your sister friends that step in.
That's good. Did you have a set of go-to girls Cherie? And how did you decide how you were going to pick them?
I will say that my sister Chantel, you guys who have sisters, those were I had built-in go-to girls. But my friendship with Pam evolved, and she actually, it's so interesting. We were talking about that she actually pursued me, and she's an ER physician, like I said. So she was like, Cherie, I really want you to mentor me, and we're the same age, and this was like 20 something years ago, and I said, are you kidding me? You're a physician. I should be sitting at your feet because you know how to do that. And but so we just developed this friendship. And when she moved here from California, she was actually on her way to South Africa. That's where they were going to move to, and she was pregnant. And so I was with her when she had her first baby, and that kind of bonded us. And then when she stayed here, when I got pregnant, and then she was with me, like I said, through all the miscarriages, I remember Pam giving me some really good counsel. Like she was at every point with me. She said, Cherie, when we were like, okay, we've made it from one trimester to the next. It looks like it's going to be okay. But I still had all this fear, all this anxiety. And she said, you're going to need to start giving this baby to the Lord right now. You're going to have to start trusting him more and more. And he's with you, he's okay. And those words never left me. And we were in a car going around, I want to say one of the circles in DC. It was a quick conversation. But when you have those friends who know you, they can get deep, cut really deeply, very quickly, and give you that word that you need. But yeah, that was an evolving go-to friendship. The time and consistency came into play, and then Chantel, who's always been there, and my other two sisters, Sherelle and Let me say their names.
Courtney, I was going to ask, thinking about when you got connected to doing birth work here in Washington, D.C., a question from the audience wants to know sort of just like, how did you get connected there? And what did it look like to form like relationships, kind of go-to relationships with the other women that you were doing birth work with?
Sure. So I did my my birth work training through Mama Toto Village. And so I think one of the pivotal aspects for me was like being able to go through this, 9-month long training with about 12 other women. And so through this process of just like learning a lot and spending all of our weekends together, we really just, sort of just formed this sisterhood. And so I think through, our own challenges and sort of going out, on births together, or sort of like being backups for each other, or even just having a lot of questions about like, where do I want to go in this work? Or like, what makes sense for me? And sort of how do we kind of like make sense of the big picture and then our like specific and unique gifts. It's just been, like a friendship and a sisterhood that I think, I have a sister and I have really good friends, like kind of going into it. Again, wasn't like, oh, these are going to be like, my people forever. But now it's like, oh my gosh, like we have monthly meetings, we talk all the time. And we're able to kind of continue to, just really push each other forward in figuring out what it looks like personally, but also sort of professionally.
Mm-hmm. If I can just hop on to what you just said at the very end there about going in, you have a sister, you already have friends, and sometimes at a certain age, you're like, I'm good. I have my community. And there always is this thought that you can't create you can't develop new friendships, especially, later in life. But it's just not true. And I feel, especially going through this motherhood journey, that I've been able to develop new friendships that I didn't know were even possible, and friendships with women who were friends of my husband or the wives of friends of his, that they have also been really helpful during this journey.
Yeah. Super, super important for that. I know that as I think about, navigating like motherhood, someone else also wondering sort of like how to get connected with other DC moms and pregnant mom groups, ways to get connected in that way. I will say, I could recommend District Motherhood. It's DC's premier mom group for moms of color. And it's started by a young woman who was a student of mine when I was doing campus ministry at Howard University. Her name is Simona Noche Wright. Just an amazing woman, an amazing mom, and beyond that, she's a great sister, a sister friend. I've seen how well she values relationships with women, and so it just naturally blossomed into an amazing organization. So Simona and Nikki, thank you for doing all that amazing work with District Motherhood, and obviously it's open to women in Washington, D.C., but also outside of the area. Are there any other sort of things that were important, I guess, to you, Brittany, when you were identifying like your go-to girls?
So I was blessed to like have close friends of mine also get pregnant around the same time. And I feel like that was purposed, like that we've been able to walk through different milestones together and our kids get to connect with one another. So that's been a blessing. But when I first got pregnant, I also was intentional about going to library story times. Not pregnant, but when AJ was first born, going to library story times or doing different mommy meetup groups to meet other women of various backgrounds so that I could build the mommy community. Because I realized as you guys are talking, I didn't grow up with sisters, and I realized that has been super important to me to build up a sisterhood, a sistership with other women. So
that's good. And so sister friend relationships aren't always sunshine and roses. I mean, I'm thinking about my relationship with my sisters, my little sisters. We love each other so much, but we've had some arguments, some different things. So shout outs to Crystal and Giovanna and Takita, I love y'all. But what does it look like to navigate those relationships, particularly when opposing views on what mothering looks like or how to become a mom, might look like, and just raising your children? How have you been able to navigate those things? What are some things that have popped up that have been opposing, and how do you continue to walk with each other even when those things happen? Malika, would you like to start?
Sure. So I have to start, of course, and shout out my sisters, Denise, Leslie, and Weddy. And even with my own sisters, two of which are mothers, and my sister friends, I had to keep in mind that we are on parallel but not identical journeys, and that my child is unique. But it's hard because there's a comparison game that you're always playing, and you want to take everybody's advice to heart, but it just doesn't always apply to your kid. And so, we've definitely had some uncomfortable moments and conversations where I felt like people were overstepping their beyond giving advice, giving criticism that wasn't always constructive. Mm-hmm. But I think that keeping it in my head that this is my journey, this is my calling, this is my child, and I have to figure out what works best for her. And I can take all the advice, but take it into consideration and not feel that other people are trying to tell me how to raise my own child.
Yeah. I know, Britt, you had some conflicting views on, or even just what it looked like dealing with comparison for how you chose to feed versus how another person chose to feed their child. What that look like for you?
Yeah, I'm a non-confrontational person, so it was never external conflict, combative, but it was always an internal conflict for me. That when people would talk about breastfeeding their babies, and I really tried and I really wanted to, but it just didn't work out for us long term. So initially those conversations would really weigh on me and I'd feel guilty, but I'm really grateful. Even though I didn't grow up with sisters, now that I'm an adult, my mom has become also a sister friend, and she's always been my support and advocate in terms of just like, do you, like, do what's best for your child. And like Malika was saying, every child is unique and different and special, and every mommy journey is unique and different and special. And so I've now become an advocate too. Like when I just talk to other women who are moms, like, do you, people are going to have a whole bunch of stuff to say and, you know, suggestions for you, but listen to your heart, listen to God, and like you and your child will be okay.
Mm-hmm.
Mm-hmm. I was going to just say something real quick. I think related to just not having children yet, and I know Latoya and I have had some of these different conversations, but I think being in a space where like I'm not necessarily in a place to have like disagreements yet, but because of some of the work that I do and just kind of being a former teacher, I have like, you know, just sort of like different ideas around like, you know, educating children. So definitely being interested in homeschooling, interested in unschooling, looking at sort of just like alternative ways to kind of thinking about parenting. And I think I've been in a space that's unique that allows me to kind of like just ask questions that maybe like sound kind of like crazy, but because I don't have kids, they're not like, girl, what are you doing yet? But you know, they're kind of like, oh, that's how you lean in, okay. But it's given me sort of just like the opportunity to even just kind of ask questions to people like, oh, like how did you choose to do this, or why did you do this, and sort of like, well, what do you think about that? And I think for me, kind of to your earlier question about like how you choose the people that you know are your girls, it's like, even if I, you know, maybe do some shit I think is crazy, it's like they're for me, you know.
Mm-hmm.
And I think that's kind of like what sustains even in what, you know, can be challenging.
Yeah. Go ahead, Sheree.
No, I would say, and I would definitely agree that, you know, you do have to be comfortable with your own boundaries. You do have to be comfortable with, like you said, each child is different. We're unique, and I think we're all given for all of our lives, you know, that this unction, this knowing for how to make good choices, this wisdom for ourselves in certain situations. I homeschooled, and 20 years ago, that was not as popular of a choice. And I will say I come from a family of educators, and I have very strong women in my life. My aunts were all teachers, and they all had something to say about this choice. And, you know, but yeah, you have to graciously kind of hear it, but not let it always influence your ultimate decisions. There's sometimes you hear some stuff and you're like, yeah. Or even if you hear opposition, I found, well, let me think through that. Let me consider it. Let me think through that. And then I think also just the broader context of friendships, knowing oneself too is helpful. So I remember early on in my friendship with Pam, I said, look, I could tell how she was, you know, very precise, and I'm not. So I said, look, well, let's just know that I'm going to give you many opportunities to exercise that virtue of forgiveness. So you get to, you know, and it kind of just lets us know, yeah, we don't have to be perfect. We don't have to show up perfect. We might disagree on some things, but where's the grace? Where's the forgiveness? This is a life, this is a relationship. So, yeah.
That's good. I was thinking about, so as an auntie, sister, friend, I mean, I don't have kids either yet, but have grown more and more into a desire for them. I was thinking about how it's been beautiful to like navigate this journey with friends who do have kids. But I could also just sort of take it back to when some of my close friends were starting to get married, and people were kind of like partnering off. I was like, okay, like, y'all don't want to just have a group together no more. Y'all want to get married, which is fine. And so, you know, the maintenance that goes into keeping up with those relationships, you know, as we're going into different stages of life. what does it look like to be intentional about maintaining those relationships as you sort of step into marriage or even stepped into motherhood, with friends who might not be there? I can just personally sort of say, like, I've always appreciated like being sort of like invited, and some of it is I am also an extrovert, so I sometimes invite myself into folks' lives. But like, but for friends who've like made space for me, it's just always felt like great. I've never felt like a third wheel. I felt like an intentional auntie, like, I'm not, I just like, it's always just been really sweet. But I know that some people are struggling with like navigating that, and even just like the boundaries that come along with that. So Malika or Brittany, do you mind sort of just sharing sort of like what it looked like to navigate, boundaries or relationships with friends, like, as you're in different stages. So whether you're a mom and they're not a mom, or, like either way. You want to go first?
Okay, sure. I think for me, this is an area that I do feel really guilty about, because before being married and before having a daughter, I felt like I was really good at connecting with my friends and keeping in touch with friends from elementary school all the way. I mean, this is something that, I really enjoy doing. And then when I got married, I felt like I wasn't doing a great job because I was trying to spend all my time with him. And in retrospect, I'm glad I got to spend that quality time with him. But now being a mom during a pandemic, I feel like it's even harder. And just thinking about, okay, who have I not reached out to in a while? Can we at least get something on the calendar? And before, I don't feel like I had to be as rigid about that. I didn't have to use Google Calendar and schedule Zoom calls and, plan months in advance. I don't feel like I had to do that as much, but now I feel like I have to be extremely intentional if I'm going to keep those relationships up, and understand that if they're real sister friends, that it's okay that a couple months goes by, and it's okay that we haven't talked or texted in a while, because that love is still there. And when we do connect, it's like we haven't missed a beat.
That's good. Mm-hmm.
Yeah, I've realized that for me, in order to be a happy mom and a happy wife, and pour into my family, I have to fill my cup up. And for me, I've realized that filling my cup up means hanging out with my girlfriends and connecting with them. And so I crave that because I know I need it in order to be fully positive and present for my family. So yeah, and shout out to all the husbands who support that, because I am super blessed to have a husband who not only supports it, but pushes it. Why don't you call your friends and go out with them? Or why don't you go on a weekend getaway with them? And that is such a super blessing for me. So yeah.
Yeah, I would just say yes and amen to that, Brittany. One of the things that Lorenzo, when people ask him, when guys say, can you give me some advice? They're getting married. And he always says, does she have girlfriends? Make sure that you support her time with her girlfriends. Mm-hmm. Step up, and make sure that's on the calendar, and it's critical. So yeah, we need that time.
Courtney, how do you deal with the mommy questions? Why don't you have kids, or why would you want to consider that as a route to have children? How do you sort of navigate that?
Yeah, I think in part it goes back to something Cherie said earlier about sort of knowing yourself, and sort of having a level of comfort and sort of just okay, I know what I want, and I know sort of who I am. I think having that, I can't stop saying, sort of just a group of women, even if that group is sort of a little bit smaller than even just the bigger circle of sister friends, being able to actually sort of wrestle out, I don't know how I feel about this, but I know what I want, and here's, some ways I'm sort of beginning to explore that and feeling safe, I think, to even question things that I maybe wouldn't have had on my radar before. I think I've been fortunate that there's not been a whole lot of sort of pressure from my family to be like, hey girl, like what's going on with your babies? Even though, I mean, it's a question and certainly like a desire. My parents, they want to have grandchildren. And I certainly want to have some for them. But I think navigating it, I think it's a very introspective process. But I think also maybe in connection with being, involved in just like birth work and being, with moms who are, of advanced maternal age and just sort of like recognizing sort of, that there are sort of real, barriers or limitations or just kind of constraints to think about, in the path to becoming a mother. I think I try to balance sort of both, my own desires and like, what I think is possible for God to do with also just like science and like sort of the realities of just like what's happening in my body. And so I think having just like an open hand, but also sort of like some knowledge and facts in the back of my head as well.
Yeah. And I can say, Courtney, it's been really great sort of like navigating this conversation with you. So, full disclosure, Courtney and I are also roommates and single girls looking to get partnered. So hit us up. Like it's been cool to have someone to kind of like ask the crazy questions with and feel kind of like, or throw out the theories and not feel judged. And so I'm really grateful for our relationship. I guess, can you think of a time that I guess a significant moment in your life where a woman like showed up for you? Like what does that kind of look like? If you could, in like a minute, if you could, a story. I'm gonna go with Cherie.
Of course you are. There's so many stories.
I'm gonna start with Cherie because I want everybody to give us a little story. Story time.
We all can relate to this. That there's too many stories, right? I think when Jordan was 6 or 4 or 5, she was. We had her at a private school, and 2 women showed up and my Chantel, my sister Chantel, and Pam, in ways that I really needed them to show up because, when she was in this school, and what I did not know, they were pulling her out to get some support, but they weren't letting her know. She was the only little Black girl in this classroom. So, and then they were saying something was wrong with her developmentally. Now, her end story is this girl has graduated from college, a year at Oxford, magna cum laude, brilliant child. But when they tell you this, and this isn't your world, right? This is your child. You become fearful, all the things. And my sister Chantel is a teacher. And like I said, and Pam was a physician. And so I was just like, oh my goodness, what's going on? And they sat me down and they were like, first of all, no one tests kids this early. And just kind of lifted my head out of all the things that can happen to you emotionally. Something wrong with my child. What am I going to do? What does this mean? I mean, you can't imagine how quickly you start projecting your whole life. And they were able to speak truth to me. They were able to say, if it is something going on, we're going to be right there with you. But let's not go there right away. And they were right in that. And so and it was because of Chantel and her expertise, because I had none and I was an emotional mess. But she was able to keep speaking to me and say, you know what, the problem isn't Jordan, the problem is the school. Let's get her out of this situation. And let's see what we can do, and that was pivotal.
That's good. Yeah. The two of Chantal in your life. A Chantal and a Pam. Anyone else have a story they want to share?
I can share a story, and this is kind of a combination of stories, but you know, I felt like I'd already gone through a grieving process. But during the pregnancy, I also thought I was going to lose my child. And so I was kind of thrust back into that and, scared about possibly losing the pregnancy, and grieving the fact that if I did keep the pregnancy, that wasn't going to have my husband. So where I was mentally was not great. And I think that my sister friends showed up for me in ways that, again, I didn't realize I needed. And so the picture that I have in my mind is laying on my couch, exhausted, feeling like things just weren't working in my favor in a host of things in my life. And girlfriends coming over with food, or taking me to the hospital if I needed to, and just kind of speaking life into me. And one friend in particular brought me a bag of maternity clothes and a teddy bear and a few other things. And I was thinking, I don't even know if I'm going to make it that far.
Yeah.
But it was helpful. So, and her name is Brandy. She saw the end from where I was, and even though I couldn't see the end of the pregnancy, I could not be in any space to be excited about this pregnancy. She was able to carry that excitement, even though I couldn't, and I just really appreciate it.
Beautiful.
Yeah, I would say for me, I'm thinking about, I guess that was years ago, when I had to go in for that surgery. And if you don't have a Latoya in your life, you definitely need one. Because like I said, as a person who can kind of feel like, okay, like I'm independent, I'm gonna just like figure this out, for her to like, drop what she's doing, show up, take me to the ER, be there with me all night, and then like, getting on the phone and calling people and making sure that, things are taken care of. My mom showed up the next day, and just, I think she's a person who like tends to like the little things that, I wouldn't even like think to know to sort of like need for myself in that moment. And was really just, doesn't ask for anything, doesn't sort of like even like expect anything in return, but really just is like a nurturer and a person who's like a caretaker, but really just from that place of like friendship for me, and even just sort of in the grieving process of like, what does this mean now that, like I don't have two ovaries now, like, just even sort of like processing through that. So I think for me, definitely, you're a person who continually like shows up in ways that I couldn't even like qualify if I were to say like, oh, this is what I need, but you show up in so many ways that I wouldn't even think of.
I love you, Courtney, girl.
I agree. Get you a Latoya. I already shared my story because that plane ride, I wouldn't have made it. I would have had that baby, those two babies, not in California. If Latoya hadn't flown with me, with a baby in hand and two in the belly, about to pop. But also this pandemic, in addition to Latoya, there are three other women who like this pandemic, everything was stripped. My way of replenishing myself and like connecting with my girls was taken away. And like I found myself like balled up in my bed, like having a breakdown. And so getting through this pandemic, that is one of my stories with Latoya and these three other women doing Zoom calls, prayers, and they probably don't even realize how much that helped me get through, but definitely helped me get through a lot.
I guess as we kind of think about the pandemic, the double pandemic, honestly, that's going on, we think about COVID-19 and just all of the incidents of racial injustice that are being publicized, not to mention the ones that don't make the news. What does it look like to I guess, navigate that and having, I guess, support with friends to sort of like talk some of that through. I know, Britt, you talked about, using technology to be able to connect with friends. But I guess just, like, what other ways have we just, like, been intentional about obviously acknowledging the really hard things that are happening in our world, in our city, even sort of thinking about, the incidences of maternal mortality for Black women in this city. Like, what does it look like to have those conversations with friends, with sister friends, feel affirmed, feel heard and seen and known, given everything that's going on?
Well, for me, one thing that stood out when we just kept hearing about the killings in the context of this pandemic, and so you're just spread out. And I go to a church in the city, predominantly white church. I'm an elder in the church, but there are Black women and women of color in the church, and these two are my sister friends, and I just felt like I need to gather these women, and for us to just get together and grieve and lament and express anger, all the things that that just come to mind. And it was so important because the pandemic had us isolated, and then sometimes one can even feel isolated in our spiritual spaces when things like this show up, when the racial injustice was just right there in our face. And even though that's not the intention, it just sometimes it can feel that way. So I thought, like, yeah, we need to get together. There was a real desire to gather my friends, to gather the women and say, all right, let's talk about this. What is this doing inside of us? And to affirm one another's feelings about it.
That's good.
Yeah, I love that you mentioned this need to gather. And I feel like pre-pandemic, we were gathering naturally without even thinking about it. And now we have to do so much more planning. And if we're together, we're wearing our mask and we're 6 feet apart and we're trying to be outside, and we're doing all these extra layers. But when we do get together, it's so affirming. A friend of ours had a birthday a few weeks ago, and we were able to gather in her backyard, just a few of us, but it was a life-giving experience. And I think it wasn't my birthday, but I felt that it was something that I needed. Even for just a few hours that I was able to get out of the house. And, I think that we have to think about, and you're talking about your church. I mean, I miss being able to go to church with my friends. I miss being able to just be in, face to face with people. But I feel like we are finding different ways to do that and to grieve what's happening in our country, but not only to grieve it, to be activists and to get to work in our professional lives, our personal lives. I know a lot of people are getting involved in the upcoming election. So I feel like we're inspired to do something and to encourage each other to do it too.
Right. That's right.
So good. Yeah, so, it's just been really great to navigate life and relationships with all of you. I'm super, super grateful. You've all played very significant roles in my life. Brittany and I met in college, and I think about just like how intentional and thoughtful she's been, a cheerleader, just a bright smile, a powerful presence, just a necessary. I couldn't imagine doing this life without you, girl. So I love you.
Love you.
Cherie, my fellow board member, I want to call you my big sister, but
yes,
but girl, I'm not trying to offend you in front of the nation. But, you know, I have two older half sisters. One of them passed away a couple of years ago. And that was a really, really hard thing. But I believe that God is just super sovereign and intentional about reconnecting me with community and sisters and sister friends. And so for you to be that presence, you know, even the one that you can cut your eyes at a board meeting, like, girl, do you know, what are they talking about? And just know the nonverbal. Like, yeah. Okay. Yeah. You saw what I saw.
I love you, Toya. So for you.
Love you too. Malika, I've always admired you, just an accomplished woman, and beyond just having all of these accolades and these wonderful, you know, things that you've done. I just appreciate that you charted your path and you're on it, and you invited this extrovert into it, you know, and it just allowed me to be there. One of the most amazing moms that I've ever known, and as you know, trusted me to be your doula in this process and to help provide childcare and everything with you. It's something that I will hold on to forever. So I'm just really grateful for your presence and just everything about you. You're just a dope woman. So thank you.
Love you. I couldn't have done it without you. Love you so much.
Hey, Courtney, my in-house homie roomie friend, my fellow Floridian, you know, my braid sister, my naturalista. You're an awesome friend. You are necessary. You are mandatory. You're smart. You ask great questions. You show up for me in ways that I also don't know that I need, but and you remind me to sit down and take rest. So seeing you model that has been really special and sweet for me. And I know that we're going to be amazing moms when it happens for us, however it happens. But I'm really grateful to be able to have this conversation with you and for you to be a part of it. And so thank you. And so as I think about the dynasty, I think about the legacy, I think about the hitters, I think about the girls, I think about my sisters, I think about Steph Love and PD Brown, I think about my mom, I think about my DCUJ girls, I think about my roommates, I think about everyone. I'm super, super grateful to have a community of sister friends. Yeah. I really couldn't do this without my girls. And so I'm very grateful for you. My time, energy, and effort, honestly, in this season, especially given COVID-19 and the racial revolution, is dedicated to women who listen when I speak. I don't have to, and don't call into question my humanity. And these are my sister friends. So thank you so much. If you don't have a sister friend, get you one. It's mandatory. So thank you all for joining us. Hope you have a wonderful, wonderful day. Bye.
Bye.
Just the name itself, I really like it. Jubilee Jumpstart, like you're jumpstarting your kids to a great future. I really enjoyed the name.
Come on.
Come on, everybody. It's like a community. It's like a family here. When I brought my kids here, I said this will be a place where I will probably keep my kids here for a long time. I'm a student. I'm a single parent. I'm striving to get my degree, and that is a goal that I'm setting in place for myself, and I'm going to get there. I have 2 kids here. My oldest, Cedric, he's been here since he was 5 months. He's now 4. My youngest, Sydney, she has been here since she was 5 months as well, and she is now 22 months. I mean, I struggle like a lot of other parents, but a lot of my difficulties and struggles that I've had since my kids been here, staff have seen it and they've asked, do you need the help? What can we do to help you? And that right there is something that's big for me.
Enrollment means everybody is starting their Jubilee Jumpstart journey. Children go into their classrooms and we almost immediately are talking to parents about their opportunities for engagement, connection, and growth themselves.
There's different parenting groups you can do. To have a group that you can connect with and be open with and share, it was great. We shared different parenting styles, parenting techniques, and that's what helped me.
Jubilee Jumpstart was founded to address the opportunity and achievement gap. We see in our city and our country that children with less opportunity achieve less, and that is generational. So when we want children to get on a path of lifelong learning, they are supported in that by the people around them also participating in lifelong learning.
When he started here in Jubilee Jump, his mind changing like 100%. They helped me to be a better mother, good person, extra good person. Jubilee helped me to feel more comfort about my person, understanding to my son. They helped me a lot.
When you teach at this age, they grasp things like they're sponges. It's just amazing seeing him grow. He loves to teach other people things. He'll show other people things. And it's amazing. And the teachers, I credit the teachers a lot. They are amazing teachers.
Jubilee Jumpstart is a special place for me because they gave me so much. Courage, wisdom. It was life-changing.
We learn in community and in relationship. And so our little place is a place where community is built, really family is built, that changes the trajectory. Children can do anything if they are given the right launching pad for it.
We don't just own anybody, we welcome whoever comes in, and we give everybody the opportunity to be here.
Nobody seems to get kicked to the side or the curb. If you see someone that's struggling, hey, you need some help? Let me help you. That's the type of community this is. That's the type of center this is. They're there for me.
To those people who help this center, the only I can say is thank you. God bless those guys who donate those money. Thank you. Thank you, thank you, thank you.
There's a major crisis with America's health system. Millions of people, including many with health insurance, are unable to get the care they need. The solution is simple. Having access to reliable, high-quality healthcare is the way to keep people and communities healthy.
That is why 30 years ago, we created Mary Center, because we believe that everyone should have access to the best possible healthcare, regardless of their ability to pay. For us, quality care is not a service, it's a human right.
For Mary Center, quality care goes beyond just medical care. It includes access to the very best in dental, behavioral health services, low-cost pharmaceuticals, education, and social services. We believe healthy people make healthier communities. So we've decided to refresh our look to show that by connecting each person to the best possible care, we will not only improve lives, but we will strengthen communities too, one person at a time. When Mary Center puts care at the core, you can too. To schedule an appointment or find out how you can help, visit our centers or go online at maryscenter.org.
This is a vaccination to keep you healthy. You don't want the measles, do you? Here's your sticker.
Protect your loved ones and they'll pass it on. Don't let COVID-19 stop you from protecting your child.
You're next, Mr. Bear. You need a flu shot.
Now more than ever, it's important your child receives their vaccines on time. Brought to you by the District of Columbia Department of Health.
Ah, good. See, it wasn't that bad.
Do you worry your preschooler doesn't walk, talk, draw, or play like other children their age? The Early Stages Center can help. Our friendly staff will assess your child's development through one-on-one, play-based activities. Early Stages will then connect your family with the educational services that are right for you. Everything is free, whether your child is in public school, private school, or not yet enrolled in school. Call 202-698-8037, a service of the DC Public Schools.
This is a total no judgment zone. We don't want parents to feel like because of X decision that they've made that they've done something the wrong way, because I know how sometimes difficult it is to manage diet and brushing. So it's important to put families at ease, encourage instead of discouraging, and making sure that they know that we are partners in their care and not those that are there just to wag a finger or judge them about anything that they're doing. To get a call from a parent that says, I can now breastfeed my child because of you. Maybe they've been told elsewhere they'll never breastfeed their kid, and a simple procedure to do something now changes that whole trajectory for them. Or a child that may have been referred to me and no one can do anything with them, and they come in and I'm going, really? The kid walked in and out smiling, like we had a ball. And we didn't have to do anything like sedation or general anesthesia, which we do pretty often, for them. We didn't even have to do that. A simple, just encouraging, it's gonna be okay, we've got this, we're gonna do it together, let me know what you need. Just kind of thinking about families and thinking about my own family as we make decisions within our practice.
Listen, every day in America, workers are forced to make the unthinkable choice between caring for themselves and loved ones or keeping their job. You know how that can be. Beginning July 1st, 2020, workers in the District of Columbia will be eligible for paid family leave. That's right. When your loved ones need you most, you should be able to step up to the plate and take care of them. That's why DC Paid Family Leave will provide up to 8 weeks of parental leave to bond with a new child, 6 weeks of family leave to care for a sick family member, and 2 weeks of medical leave to care for yourself when facing a serious health condition. Hey, we understand that sometimes life happens, and you shouldn't have to choose between your livelihood and your loved ones. So if you want to learn more about DC Paid Family Leave, check it out at dcpaidfamilyleave.dc.gov.
Complete the 2020 U.S. Census. It is safe and secure. It benefits your city, your community, and your family. When you fill it out, you will help determine where billions of dollars will go, funding our kids' education, school breakfast and lunches, healthcare and Medicaid for our seniors, better social services, creating more affordable housing, job training, and helping everyone have access to food. Complete the census online, over the phone, or once you receive it in the mail. You matter. Get counted. 2020census.gov.
we've been able to really shift our care according to what we feel like the population needs. I think one of the things that makes us strong is that we provide culturally aware care. I think it helps that the majority of our midwives are of color. When we're talking about birth disparities, especially with African American women, I think that we are now entertaining the conversation about years of generational distrust with a lot of healthcare systems. And so I think that we create a safe space for that interaction, not only by having more staff of color, but also just things like our late policy. Midwives, we see our patients regardless if they're late. We see pregnant patients late and we see babies late.
Our whole family is just tied up into Community of Hope.
Hi, I'm Heidi Murkoff, author of What to Expect When You're Expecting, and you may have heard moms matter to me a lot. That's why I founded the What to Expect Project and why I'm here to support Mayor Bowser's National Maternal and Infant Health Summit, because every mom should matter. I always say motherhood is the ultimate sisterhood, that no matter where she lives, her cultural, socioeconomic, political profile, the color of her skin, every mom shares a common goal. Every mom wants the best for herself and her baby. But far too many moms, especially Black moms, don't receive the quality, respectful prenatal care they need and deserve. Too many Black moms die of complications of pregnancy and childbirth, and far too many of those deaths are preventable. And the onset of COVID-19 has increased the risk for Black moms. Gaps are widening as clinics and hospitals in rural and urban areas close, and care becomes even less accessible, and more of our most vulnerable moms, moms I speak to every day, are falling through the cracks of care. The truth is we can take care of our moms and control a pandemic at the same time. We just have to pick our healthcare priorities, and we have to stop always putting Black moms last, like they don't even matter. One way we can do that by voting. This year, WhatToExpect.com, a home to over 19.6 million moms, and the What to Expect Project have launched #MomTheVote to urge moms to speak up and be heard, to vote for those who vote for them, for maternal health care that doesn't discriminate or come with a use-by date, and that isn't paused because of a pandemic, for paid family leave that allows moms to care for themselves and their babies instead of forcing them back to work after only a week or two, affordable childcare, and so many other policies that impact their lives and their children's futures and that of their mom sisters. There's no better investment in our future than the health and well-being of our moms, all of our moms, no exceptions, no disparities. Let's stop failing our moms. Let's make moms the priority they should be.
Paternally Yours, hosted by Help Me Grow and DC Health.
Good afternoon, and thank you. Welcome to Paternally Yours. We are a part of the Help Me Grow team, a part of the DC Health family. Our particular session this afternoon is supporting fatherhood inclusion in the early years of development, 0 to 5 years old. My name is Todd Elliott. I am the program coordinator for Help Me Grow and fortunate enough to be a part of the team. Before I get my co-facilitator and our team lead to introduce herself, I'd like to thank her honestly from the bottom of my heart for the opportunity to talk about paternal health in a way that is creative, in a way that's thoughtful. I didn't want to come in just bum rushing the show, but when I got to Help Me Grow, I noticed that on a national level as well as at a local level, we were trying to be inclusive to and about the one. You can't talk about two without the one. And when I say that, that means moms and infants, but also inclusive of dads. And so you're going to hear some of the great works that's coming out of what we've looked at initially, and you're going to learn more about what Paternally Yours is. But thank you so much from the bottom of my heart, Tunde. I love being under your leadership and for your work.
Oh, thank you, Todd, for that warm introduction. I appreciate it. It's great to have an amazing team. So welcome, everyone. My name is Omotunde Shawali West. Many folks know me as Tunde, and I have the pleasure of serving as the Early Childhood Division Chief, as well as the Program Manager for Help Me Grow at DC Health. And we are located within the Community Health Administration at DC Health, and we're under the Family Health Bureau. So we're super excited to be here to talk about this amazing topic and including fathers. And Todd's really gonna, this is his efforts. As much as he thanked me, I want to thank him for bringing this to the forefront and just really making sure that fathers are included in this space.
So we're going to talk about a couple of the objectives of today's Paternally Yours and Help Me Grow. You're going to learn a little more about what Help Me Grow is. Paternally Yours is the framework of which we actually see our work being important and how we actually frame it here in the district. But it is a national effort with our Help Me Grow national office. We approached them with this particular effort and this opportunity. It was a workshop that was supposed to be done at our national convention in Indianapolis this year, but it did not happen because of COVID-19. But our objectives this afternoon are to discuss the opinions and thoughts of men working to be a part of their children or child's lives. We have had a lot of candid conversation with men in the district. Also, this is conversation that is happening around the country that I've been fortunate enough to be a part of. The second objective is to learn how the Help Me Grow program has become of the prevailing attitudes about fatherhood inclusion. I am very much of the opinion that we've got to change the narrative in terms of fatherhood engagement and change the narrative to fatherhood inclusion. You'll learn more about that and why my feelings are that way, and why a lot of our constituents and a lot of the admin personnel that are involved in fatherhood initiatives also feel this way. And our final objective is to discuss plans to incorporate partnerships, data, strategies that encourage fathers to participate in a more comprehensive and more inclusive, again, maternal and family health network. So what exactly is this thing called Paternally Yours? Well, to be honest with you all, Paternally Yours is an invitation. It's an invitation to fathers in the District of Columbia and potentially around the country and with our affiliates in our Help Me Grow network to encourage them to take ownership of their own health and to also provide support for them in fatherhood programs, fatherhood supports, and outside sort of network support in relationship to fatherhood inclusion. How do we do that? How does this actually take shape? Again, using Help Me Grow as a referral platform and as care coordination coordinators will connect fathers to various services within the district to support their needs and provide guidance on parenting, on support, on developmental delays, and looking at all of the aspects that make a father a good father and a good match maternally and also in relationship to the most important thing, to the child or infant. Now, throughout our particular presentation today, we're going to be asking you to respond in the chat, talk in the chat. I just want to think about this for a minute. With Paternally Yours, this is an opportunity, if you had just a moment to write to your father or to write to your father figure, what would you say? What would you make a list of some of the most important things that actually took place in your upbringing when you had your particular father or your father figure? What would you write? What would you say? Some of the values that you hold true, and then some of the values that you may honestly be letting go of. I will say for myself, my father passed away in February of this year, but I had him for a good while. And I think one of the most important things that I also saw from him, and then I learned from him at a distance, was character. And it was all about, how are you, Todd, when people aren't watching? How are you perceived when other folks aren't watching? Tunde, can you remember anything, or I'm sure, no pressure, because I know your dad is watching somewhere in California, but can you think of some of the things that you might write or you might remember? And please, think about this to write down in the chat. Tunde?
Sure. Yeah. So I thank you for that question, and I'm looking forward to seeing folks' response for this. So one thing that I just still remember, my dad is a classical music connoisseur. He loves classical music, and that's one thing that I still kind of hold close, near and dear to me now. Even as a mother, that's how I put my boys to sleep. Sometimes playing a little bit of classical music to help them sleep. So that's one thing that I remember. And it helps even soothe me and relax me. And then also my dad is super detail oriented. So I think that's where I get some of my detailness from, and just kind of being super detailed. So those are the things that really stick out. And also culture. So folks who know me, my father, he's from Nigeria. So really holding those values and just the richness of the background is important to me, and passing that down to my boys and even my husband too. And a lot of times when folks hear my boy's name, they're like, "Oh, you actually named your sons." I'm like, actually, no, my husband picked out the names. And although he's not Nigerian, he understood how important that was to me, just because of my relationship with my father.
Absolutely. So we're thinking about father figures, and you'll learn more, and we'll talk more about this. Father figures or fathers, dads, whatever, uncles, grandparents, it's grandfathers. It's very important that we remember some of the aspects that actually shaped us, some of the things that made us. And you'll hear more about that, and we'll go into the chat and talk more about what you guys had to say and what you were thinking about. If we don't get to it throughout the presentation, we certainly have time built in where we can talk about it at the end. I think it's a worthwhile opportunity for all of us to think about just who we are, where we come from, and the duality of that oftentimes gets lost in somewhat of the maternal and infant connection. But our next slide, introduces, Tunde's going to talk a little bit more about Help Me Grow and the Help Me Grow aspects and the detail orientation that sort of comes with care coordination. And I'm going to chime right in with some of the conversations and some of the pinpoints that we've heard from fathers thus far. Tunde?
Yeah, so thank you for that, Todd, and thank you for that that engaging activity, and just to the reflection to think back just on some of the things I learned as a child, as a young child. So Help Me Grow as a program, and I really want to touch on how paternal health is really embedded into our system model here, and I'll touch on our components. As you see here, there are 4 components of the Help Me Grow system model. So Help Me Grow is an actual national model. It's not just a local program here. It's a national program that was started in Connecticut in the early 90s by Dr. Paul Dorkin, and he's a pediatrician, and he saw just over the years how a lot of his patients would come in with a variety of issues, a variety of concerns that he was not able to, in that well child visit, was able to just focus on. So with that, he started this program to really help parents and help families really connect them to different resources that were in the area. So Help Me Grow is literally what Todd said, a care coordination program. We're not here to reinvent the wheel or create another program, but our goal is to connect with programs and resources in the District of Columbia and connect our families to these resources. This is important because just as a parent and as a professional, one of the things that can be frustrating is navigating a system, right? So Help Me Grow really is that care coordination system, and really making sure that families, especially in the early years, are connected to those vital services. And the way we do that is our first component, which you see here in the orange, is our centralized access point. We'll touch a little bit about our number. Some of you may have heard 1-800-MOM-BABY, which is a very popular number in the District of Columbia, but that really connects families and providers to the services that our care coordinators are able to provide. Those are also provided in different languages. We have a bilingual care coordinator who works with our Spanish-speaking families, but then we also are able to provide other languages as well through a translation line for our families who need those services. And all they have to do is call, again, you'll hear us say this over and over, 1-800-MOM-BABY, and they're able to be connected to a care coordinator who would then connect them to either child development resources, child social and emotional resources. And one of the things I want to touch on, although that's our main focus, we recognize that families need additional services, basic needs, diapers, safe sleep products. We're in the midst of COVID, so we have a lot of families who've called in around mental health supports. So we want to make sure that we're able to connect our families to those resources so that they're able to be supported. And that all happens through what we call, again, our centralized access point, or our CAP. The other two that you see here, which Todd does so well, is outreach. In our green and our purple, we have kind of a two-component outreach approach. We have our family and community outreach, where we really work with our families. We work with the community to really make sure we understand what is needed. Because we may say as a program, hey, this is what's needed for the community. This is what's needed for the families, but we want to hear from families. We want to hear from the community what is needed. So this is why we have different events. One thing that we had last year, an event last year, some folks were able to attend, was our Books and Blocks kickoff event. And we were really excited to do it this year. But as we all say, COVID has come and kind of changed the way we do things, but we will be planning some virtual events to connect with our families in the same way. But with that actual event, we were able to hear what folks needed in the community. And we really take that and we take it back and we work as a team to really make sure that we're able to connect with providers, connect with different organizations across the city. One of my favorite words, and my team knows this, is collaboration. We can't do this alone. We have to work together. I've heard on many of all the wonderful presentations that have been going on, it takes a village. I've heard that as a common theme, and that's something that I hold near and dear to my heart. So really hearing from the community and hearing from families what is needed, but the only way to do that is work as a village. And then there in the purple is our child health provider outreach. And we want to hear from providers as well too. How can we help providers and support providers? Providers are extremely busy, and we recognize that and we respect that. So therefore, we want to know how we can best, at Help Me Grow, work with providers in order to support them in their roles in order to help families. And that's what Help Me Grow does. So I'll give you an example. If a pediatrician, is working with a family addresses a concern around their child's development and their child not meeting that particular milestone, all that provider has to do is connect with us. We will work with that family, of course, with that family's consent, and we will make sure that that family is connected to different services across the city. We work closely with our partners at Early Stages, Strong Start, and many other different programs here in the District of Columbia to make sure that our families are connected. And one of the things that makes Help Me Grow really special is that we make sure that we follow up with our families. We're not going to give you a number and say, hey, call this organization. That's it. Goodbye. We want to make sure that our families are connected. And if our families say, hey, we have it from here, we respect that. And we make sure that, we say, if you need us, we're here, 1-800-MOM-BABY when it's needed. And then the last component, but a very important component, is our data collection and analysis. And you'll hear me say this a lot, but data is really what drives our program. We come together as a team, as well as an agency, to really look at the data and to make sure that we're doing what is needed for the District of Columbia and their residents. Are we meeting the needs of the residents? So really looking at that data to inform if we're touching the children the way they need to be helped in these early years. So this is how we're able to get to where we are today with paternal health, because as when Todd came on board, he recognized, hey, we really need to support fathers who are calling into the centralized access point, and how can we provide them with services that are needed, especially, dads who may need assistance with supporting moms, supporting family members during early childhood years. So really looking at that data really brought us to where we are today, and brought Todd to come up with Paternally Yours to really work with our national office, but also work with our agency to work with fathers. So Todd is going to touch on some of the things that we heard, not in the community, only in the community, but as well with our families as well.
Thank you, Tunde. Very comprehensive as always. One of the things that I like to say again, the fatherhood inclusion aspect versus engagement, and you'll hear me go back to that on a couple of occasions. That's really important in that particular narrative. But some of the conversations that we heard over and over, and this is just about 5 bullet points that speak to that particular piece, is that conversations on paternal health or men's health need to be enhanced in the early childhood health spaces. We're not having enough conversation about what men need during this particular time period, particularly during childbirth and thereafter. Many fathers have been excluded from their role of parenting for a number of reasons. Some are in what is a mandated role. Some are, feel disconnected from their families. Some are just struggling to put food on the table. And so there were a number of reasons. And I will say this, to Tunde's point, this was what we heard in the district. And prior to, I was in LA at the Father and Families Coalition meeting in January, prior to COVID really taking shape and being recognized as a pandemic. But what we heard out there as well is that many traditional maternal and child health programs don't highlight the role of the father as the social emotional support. As you heard Tunde mention and talking about her dad, the gleam in her eye is that social emotional support, how she feels about herself, the things she remembers as being a child, and that what she can carry over to her own family and her own boys. And I will say this, my wife and I are very aware of when my little 5-year-old thinks I'm a superhero. So she gets all of that, daddy can take care of it, and I can do these things too, from me as the father and as taking the lead. So again, social emotional support. You heard me mention this one earlier. Many of our fathers are dealing with the legal system, particularly in African American communities and communities of color. We're in a mandated role that has to be supported before we can really get serious about rescuing the child and the family holistically. There's a lot that goes on. Last night, I was so inspired by a couple of young ladies. I have a youth development background, and I just a snippet before I took off for the night. And they were talking about being young mothers and their perceptions of being moms, and what their perception and their perspective in dealing with the fathers of their children, what that actually looks like. And it was very enlightening. It was very heartening, but it was also an opportunity that what we really want to do with Paternally Yours, what Help Me Grow really would like to see, and it's a personal passion, is to help some of those stressful and systemic barriers that are affecting our young fathers and mothers, particularly in the district, particularly in our wards and clusters 7 and 8. We'd like to see those, we'd like to hear from those particular young people. It isn't about just cohabitation. It isn't just about getting married. It's about full role so that all children can have a chance at life, particularly between the ages of 0 to 5, which is so important and so prevalent. So what you'll see in our next slide, if you will, Tunde, what we're discussing in terms of paternal health are what we do in terms of Help Me Grow as a whole. Help Me Grow right now is a national partner to the Help Me Grow Network and other affiliates. We are a part of and have been charged with a great responsibility as an innovation advisor for a WIC program and WIC Innovations. And Tunde is going to talk more about what we help to provide from the provider perspective, but this is also community related. You have to keep that in mind. Data is not just for data collection's sake. Data says, do we or are we reaching the right aspects of the community? Are we asking the right questions? How can we continually move forward? I love that I'm seeing questions from the chat, and I promise, Kirsten, that we'll get to all of your questions towards the end of our presentation. We promise. But Tunde?
Sure. So thank you for that, Todd. So one of the things, as I stated, is we want to make sure that we're also supporting our providers so that they're able to best support families. And the way, these are just a few ways that Help Me Grow DCs works with providers in order to support families. So we provide consultation and support. What does that look like? So technical assistance. So working with providers to really understand what support they need and different trainings. For example, we do, trainings on the ages and stages questionnaire, not just the ages and stages questionnaire, development questionnaire, but also the social and emotional questionnaire. So we work with providers to do that training to help them facilitate that. But one of the things that we also do too, I'm skipping down to access to the 1-800 Help Me Grow phone line, but family as well as providers are able to call in to get that screener. And what that ages and stages questionnaire is, it just really help families really understand where their child is developmentally as well as social and emotionally. So we work with providers to, if a provider needs to send a family our way to get those particular services, that is one way that we're able to support providers. Again, I can't say it enough, collecting data and sharing that data. One of the things that we do at Help Me Grow is we have what we call a resource directory, and that resource directory is quite rich. And the way we're able to include organization and resources is by exactly what Todd does. He goes out, he does presentations, he works with the community, as I stated earlier, works with providers to make sure that we have the resources that are needed for our families. And we collect that information and we include that information in our resource directory so that when we do partner with different organizations and an organization wants to partner with us, we're able to share that data so that we're able to allow that organization to understand how we're working with their families and to have that shared relationship. Another thing that we do is a quarterly newsletter. And this is something that we put on pause a little bit due to COVID, but we basically, in this newsletter, it's really to highlight the amazing work that is happening in the early childhood health space. There are so many organizations that are working in this space and that are doing great work. And we want to recognize those organizations. And I want to step outside of early childhood for a moment, but there are many organizations that support families just within this space. So making sure we recognize those organizations as well too, because sometimes we have families who call into our call center who have older children. So we want to make sure we understand what resources are out there so that we can internally connect families to those services or externally connect families to those services. And we do that by kind of highlighting those programs within this quarterly newsletter. So these are just a few ways, but we also want to hear from providers. How can we help you so that you're able to really provide that support to families? And one of the things that before I transition back to Todd, there's so much going on in the fatherhood space in the District of Columbia. And Todd has been really instrumental in working with different organizations and different agencies, and even working with our partners internally to really figure out how we can support fathers, what resources are out there for fathers so they can feel supported in this space. And he's going to talk about what that looks like and how he's been able to really garner that support in this space.
Thank you, Tunde. And to be honest with you, this is just a snapshot of the work that's been done, not just done by myself, but we have internal partners. Tunde is all about collaboration. She goes up and down the steps of a 9-floor building or 10-floor building on a regular basis. She encourages us to get involved with our other early childhood partners within DC Health and outside of. but this is what it all look like and where are our sort of starting spaces. These are, again, sort of 5 out of at least 20 different spaces that we'd like to be in, that we already are existing in, and that we're moving forward with connecting to. Our fatherhood care coordination, parent cafes, and there are a great number. I know in Ward 7, there's a lot of great parent cafes that are just dedicated to men and that are dedicated to fathers. But we want to look more into legal rights, mental and physical health. Again, that paternal health supports, understanding the cancers that affect men, for example, and looking to work with a number of partners. Tunde has mentioned several. We have so many, and we have a cadre, but we're working heavily with the Fatherhood Commission and members of Office of Father, Men, and Boys. Thank God for them. Colleges and universities, we're beginning to tap interns that are interested in looking at data sets and looking at sectors of the community. 501c3s, nonprofit. We have researchers, behavioral specialists, other executive office of the mayor affiliates. If you're interested or you're already working with, we know that we had several people sign up for today. Thank you so much for being here. But we want to hear from you. 1-800-MOM-BABY will put you in touch with either one of us, and it will also put you in touch with a little bit of how care coordination works. This other particular piece, and again, you've heard me sort of reiterate this already, to help change the engagement narrative to fatherhood inclusion, fatherhood touches, or navigating fatherhood. Again, you're going to hear in a moment why engagement is one of those things that sort of has created some isolation in my view and view of others in conversation. One of the other things, I come from a background from workforce development in dealing with young people and connecting our fathers and mothers to WIA, WIOA style one-stops trade programs, WIOA, the Opportunity Act, and the Workforce Workforce Development Act. What we're trying to do is to give our young people a chance to start certifications, to start trade programs, to look at opportunities, as WIOA says, to look at opportunities to be in a one-stop where they can talk about resume building, they can talk about, but also we want to talk about social, paternal, and supportive supports. Utilizing technology as a means to rally our fathers throughout the district, that's something I can't speak to it wholeheartedly right now. We are working with our Healthy Start partners on a super cool initiative that if it goes into play, our fathers will have a chance to stay connected and are connected from the beginning. And it'll be a nice initiative for DC residents that we could see working with our affiliates throughout the nation. So those are just some of the key sort of points. And moving forward, we've got to make sure that inclusion conversation, okay? Because this is how this came to be. I was at the conference in LA, the Families and Fatherhood Coalition. I've always felt, and I can't take full credit for this, I'm sure someone else thought this way as well. When we said fatherhood engagement, it's sort of a militaristic term. It's sort of war verbiage. We're at war with fathers for them to participate. I think of World War I, I think of World War II, I think of engagement, Pearl Harbor. You know, those are the things that we have to be mindful of, that our language doesn't begin to actually separate us from the beginning. Fatherhood engagement assumes that work needs to happen based on some particular premise. For example, it says that fathers are not already engaged or are not in the picture related to their children. Or in a lot of times, what we learned from those young ladies last night, those fathers want to be a part of, but because of systemic barriers are oftentimes excluded from being a part of their child's life. And it sort of sets them back. So here's the thing in terms of fatherhood inclusion that I've began to say, and again, if this comes out later, then I want my points for it. But if you never hear it said again, it recognizes that there's active opportunities for real-time changes. It's ways in which we can work surrounding paternal health, and it's ways in which we can include our fathers by saying, hey, why don't you come in and get a blood pressure check with us while your wife is, or while your girlfriend or your baby's mother is being seen by the doctor. Why don't you come in and get a blood pressure check and let's see how your temperature is going and see what's going on with you. So again, inclusive factors that don't necessarily, and I'm not saying that we're getting rid of the entire language, because it's been a long time where we've heard engagement. We see it in every facet, workforce engagement. We see it in youth development engagement. But I think that there's a step that has been missed in when we say engagement versus inclusion, and being inclusive and understanding connectivity through inclusivity. Next slide. So the question remains still, like Todd, Tunde, you said all of this great stuff, and this is an opportunity for you all to hop in the chat and to talk about, but why? Why fatherhood inclusion? Why now? What are the values that fathers hold and bring to the table? If you want to take 1 or 2, maybe 3 minutes to put in why now and why this is so important, and we will take a brief pause and we'll get back into some of the reasons statistically why this is so important. So please take a moment in the chat.
And we have some really good questions, Todd, that I can't wait to get to towards the end. So these are really good questions that
I saw that. I saw that. This is awesome. That means it's happening. So we can talk about a lot of the rationale as to why a lot of information, and we just learned that there's a delay in viewers getting into the chat, and that's no worries. We're all working with this new broadband opportunity. I'm sure there's been some delays in my conversation and delays, but as a whole, the data and statistics that sort of validate our position at this point, it looks like this. 90% of a child's brain development happens before the age of 5. That means that in the womb and up to 5 years old, and I've always said this, maybe up to 6 or 7 years old, those elements of the brain where cognition is taking place, where worry and wonder and all of the wonderful things that how interpretation sort of happens, that's already happening. The last 10% of brain development happens after age 5. So that inclusion of a father figure or 2, and you can't talk about 2 without the 1, again, to talk about a father figure is having an opportunity to be a part of an exercise, to introduce an activity to their child in a way that would help brain development. Another thing statistically that we know of to be true is that 1 in 4 children are at risk for developmental delay. And one of the aspects, and Tunde has touched on this, is that those ASQs, doing those particular developmental screenings, but also the interpretation of what those ASQs are all about. That's what really, in those particular screenings, that's what we're interested in. Because a developmental delay, in all honesty, and a lot of people don't talk about this, developmental delays don't have to be life-altering. If caught early enough, they can be used, and we can change some of the assumptions that go along with it. The third particular statistic that influences our thought patterns as it relates to maternal health is that children of mothers suffering from maternal depression are more likely to have cognitive, neurological, and motor delays. Now, even with this example and all the good information here, who's missing? You can't talk about the 2 without the 1. Who's missing in the diagram? And so our data and what we know to be true is that as mom may spiral towards the depressive side, fathers may be more interested in their energy and their efforts go upwards, where they're so excited about wanting to learn what to do, how to hold. I know I was one of those dads that was the first. I couldn't put her down. The nurse told me when and how the baby needed to have some rest and to sleep. So cognition is a big part of it and a big portion of this. And then statistically, again, you've heard me talk about just the facts are this. The facts about social emotional health, that comes 100% from our fathers. But I think what's relative to this particular discussion and this particular summit is that the statistic in the middle, infant death within the first 28 days of life, is actually 4 times higher for those with absent fathers than those with involved fathers. So dad, you're a coach, you're a father now. You're helping mom to understand. I mean, can you think about a scenario where a child is hooked up to a respirator or might be in an incubator? We need you, Dad. We need you around. The National Fatherhood Initiative is awesome with putting out statistics and facts as it relates to children. Again, you've heard me talk about emotional development. And then children who live with their fathers do better in school. So those are just some of the facts. I mean, there's plenty more reasons as to why this paternally yours is something that we're targeting, that we're tagging. Tunde, next slide. So just thinking about, again, not just fatherhood inclusion, not just fatherhood engagement, fatherhood inclusion. So again, we're asking, and we can get to it towards the end, so don't worry about the lag or delay. Who needs to be at the table and making sure our fathers are included in early childhood development? Is it health departments? Is it hospitals, behavioral health supports? Is it the legal community? Is it media telling better stories about our communities and communities where fathers are walking children to school, which happens on a regular basis, mind you, in the District of Columbia? You can see it in a regular school day that fathers are happy to walk their children to elementary school and be right there at the end of the days. So again, this is one of those interactive in the chat. Who needs to be here? Is it the faith community? Again, is it the legal community? Is it the Department of Education? And not to call people out, but to have access to actually moving forward in this particular conversation. Thank you, Kirsten, for your sentiments. Yes. Who else needs to be there? It's a long list. It's a concerted effort. And I think just the final answer to that question, Tunde, if you could give us a response to some of the people that need to be involved, what would it look like? It's everyone. This is something we talked about in LA that we are happy to bring back to all of the information. We are certainly proud of the work that Paternally Yours has been able to be a part of, that we've been able to bring around the table. We have a unique opportunity here. The district, with our administration and some of the great works that are being done already. Moving forward, though, our last particular thought around Paternally Yours, and something that you should be thinking about, this is what we need to consider. Dads on the outside, hey, and I've been down this road, trust me, stay down it. I'm fine, I'm good, I'm all smiles. Shout out to the Dads Net. If you ever go and take a look at some of their great artwork and some of the great stuff that they're doing. But dads on the outside, I'm fine. Dad on the inside, I'm lonely, money worries, stressed out, burnt out, feels trapped, confused. Just thinking about having to navigate some of the systems that we discussed and some of the things that we have talked about today. Let's be mindful, not only in our paternal sort of pursuits, but in our everyday pursuits, that we are checking in with our own mental health, that we're being mindful that we are in a pandemic and that things are vastly different than they normally would be. I would say again, that it's just what are some of the other feelings or some of the other things that need to be discussed. But in closing, we want to thank you for being a part of Paternally Yours. We hope that you've heard something here today that will spark your interest and that you'll give us a call at 1-800-MOM-BABY. Again, that's 1-800-MOM-BABY, maybe one day, Mom, Dad. 1-800-MOM-BABY. Also on the email, you can email us at helpmegrow.dc@dc.gov. I just want to take, again, a personal thanks to our Help Me Grow national team, our district team who does wonderful work, our care coordinators that are out there beating the street. Special thank you to our DC Health family that is in the streets nonstop, making sure that we're safe and that this particular event can still take place. And also, just on a personal level, a thank you to Mayor Bowser for her leadership and optimism throughout this particular pandemic and also just moving our city forward. Thank you, Mayor Bowser, and thank you to your administrative team. Tunde?
Yes, thank you, Todd, for that very just informative presentation, and just for your efforts on this topic. And just thank you for everyone who's joined us today. Again, if you want to get in touch with us, this is our number, 1-800-MOM-BABY. I do see a few questions in the chat box that we want to touch on. One of the questions that I've seen a couple of different times is, what is the age range of your fathers? Someone's interested in really learning how Help Me Grow with teen fathers. As long as you are a father, we are willing to work with you. We definitely can do presentations with high schools as well, because we recognize this, even from hearing Todd touched a little bit on this earlier from the amazing young women who spoke last night, the last session last night, and just their experiences of navigating the system. We really want to work with those young parents. And so really, because even just now as a mother, it's hard to navigate a system. So just being young, I can only imagine just how hard it is to navigate a system. And that is what Help Me Grow is here for. So another question, there's so many great questions. What do you think we can do as a society in order for fathers to be considered in a child's life? I'll let Todd answer that one. And then I also do want to recognize there were a bunch of questions on just kind of the legal system and just how to work better with fathers to really support them. So I don't want to, the next session after us, they're really going to touch, and they're colleagues and partners of ours, they're going to touch on just working with fathers who have been incarcerated and coming out of the incarceration system. So I think they're going to do great in really touching on that and this amazing work that they have done. So I'll start it off. So one of the things I think is important to really support a family as a whole. I think that's number one. And that is what we at Help Me Grow, we want to provide as many resources to families to support them. And that is where we're always looking for ways to fill the gaps that may be there. So we want just some of the things that we've already recognized as a team is just seeing the many great presentations that have gone on within this summit. I've already reached out to my teammates and say, hey, we need to connect with this organization. They're doing great work in this field, because something that I always say when I sit at the table is, we all work with the same families. We all work with the same providers. And how can we work better collectively to meet a common goal? We all want our children to grow up healthy. We all want our children to strive. And the only way to do that is to work together and to make sure that we're sharing resources. And I can't say that enough. So there's, go ahead.
I'll also, just to echo 100% of that, but the other aspect that I think we've got to meet our families, and you hear this so often, but we don't practice it enough. We've got to meet our families where they are. We have to meet our young fathers as well as our older fathers, as well as, expectant fathers that have had experience, the whole nine. As men, we have to have more men in these conversations and talk about mistakes and talk about challenges and talk about the things that upset us. And we can't, once we have a child, then it really is sincerely, the maturity level has to be placed on that particular child. And what I mean by that is we have to have a standard by which we interact and that we talk with our particular partner, no matter if, it's all about when the love, quote unquote, and the lust is gone, who's left and who's still standing? It's the child. And so putting a lot of focus within that, regardless of the particular circumstances you find yourself in with the child's parent or your significant other.
And I'll get one last one last question before we end. Why do you think fathers are left out of the family unit?
Well, besides the elemental theories that I could get into and redlining and all of those sort of elements, I think that out of convenience it's become something that we've become used to. And it's not until we have opportunities like this to talk about maternal health and talk about the importance of why are men more likely to have diabetes, why are we having more instances of pancreatic cancer, different elements, because if we start talking about health and start talking about living longer, then there's the opportunity for us to be, there's my word, inclusive. So I think inclusivity, I think engagement, taken back from some of the conversations that I've had around the country and also locally, is that it's just been easy. And it's become not only coincidental, but it's become a part of the systemic barriers that we are actually a part of the actual barrier itself. And so again, wow, that's a huge question we could spend days and nights on. I don't know, Tunde, do we have time for more?
We don't have time for more questions, but again, I do want to say if folks, we have a number of amazing questions, but if folks want to reach out to us again, we can come to you to do presentations as well as work with your organization, work with your families. We are here, but we want to make sure that you all know we're here as a resource. So again, 1-800-MOM-BABY is the way to get in contact with us. Our wonderful care coordinators will make sure to send us that information. So if there's a presentation you would like us to come do with your families, with your providers, please let us know. If you have families who can benefit from these services for young children 0 to 5 years of age, please contact us. We have a referral system that our care coordinators can work with you all to make sure that our young people grow up to be healthy. Again, 1-800-MOM-BABY. I can't say enough. It's an easy number, so that's why we keep throwing it out there. But please reach out to us. And again, thank you for having us here. And this is amazing summit and just hearing all the amazing presentations that have gone before us and that will go after us. Thank you.
There is a major crisis with America's health system. Millions of people, including many with health insurance, are unable to get the care they need. The solution is simple. Having access to reliable, high-quality healthcare is the way to keep people and communities healthy.
That is why 30 years ago, we created Mary Center, because we believe that everyone should have access to the best possible healthcare, regardless of their ability to pay. For us, quality care is not a service. It's a human right.
For Mary Center, quality care goes beyond just medical care. It includes access to the very best in dental, behavioral health services, low-cost pharmaceuticals, education, and social services. We believe healthy people make healthier communities. So we've decided to refresh our look to show that by connecting each person to the best possible care, we will not only improve lives, but we will strengthen communities too, one person at a time. When Mary Center puts care at the core, you can too. To schedule an appointment or find out how you can help, visit our centers or go online at marycenter.org.
This is a vaccination to keep you healthy. You don't want the measles, do you? Here's your sticker.
Protect your loved ones and they'll pass it on. Don't let COVID-19 stop you from protecting your child.
You're next, Mr. Bear. You need a flu shot.
Now more than ever, it's important your child receives their vaccines on time. Brought to you by the District of Columbia, Department of Health.
Oh, good. See, it wasn't that bad.
Do you worry your preschooler doesn't walk, talk, draw, or play like other children their age? The Early Stages Center can help. Our friendly staff will assess your child's development through one-on-one, play-based activities. Early Stages will then connect your family with the educational services that are right for you. Everything is free, whether your child is in public school, private school, or are not yet enrolled in school. Call 202-698-8037, a service of the DC Public Schools.
This is a total no judgment zone. We don't want parents to feel like because of X decision that they've made that they've done something the wrong way, because I know how sometimes difficult it is to manage diet and brushing. So it's important to put families at ease, encourage instead of discouraging, and making sure that they know that we are partners in their care, and not those that are there just to wag a finger or judge them about anything that they're doing. To get a call from a parent that says, I can now breastfeed my child because of you. Maybe they've been told elsewhere they'll never breastfeed their kid, and a simple procedure to do something now changes that whole trajectory for them. Or a child that may have been referred to me and no one can do anything with them, and they come in and I'm going, really? The kid walked in and out smiling like we had a ball. And we didn't have to do anything like sedation or general anesthesia, which we do pretty often, for them. We didn't even have to do that. A simple, just encouraging, it's gonna be okay, we've got this, we're gonna do it together, let me know what you need. Just kind of thinking about families and thinking about my own family as we make decisions within our practice.
Listen, every day in America, workers are forced to make the unthinkable choice between caring for themselves and loved ones or keeping their job. You know how that can be. Beginning July 1st, 2020, workers in the District of Columbia will be eligible for paid family leave. That's right. When your loved ones need you most, you should be able to step up to the plate and take care of them. That's why DC Paid Family Leave will provide up to 8 weeks of parental leave to bond with a new child, 6 weeks of family leave to care for a sick family member, and 2 weeks of medical leave to care for yourself when facing a serious health condition. Hey, we understand that sometimes life happens, and you shouldn't have to choose between your livelihood and your loved ones. So if you want to learn more about DC Paid Family Leave, check it out at dcpaidfamilyleave.dc.gov.
Complete the 2020 U.S. Census. It is safe and secure. It benefits your city, your community, and your family. When you fill it out, you will help determine where billions of dollars will go, funding our kids' education, school breakfasts and lunches, healthcare and Medicaid for our seniors, better social services, creating more affordable housing, job training, and helping everyone have access to food. Complete the census online, over the phone, or once you receive it in the mail. You matter. Get counted. 2020census.gov.
We've been able to really shift our care according to what we feel like the population needs. I think one of the things that makes us strong is that we provide culturally aware care. I think it helps that the majority of our midwives are of color. When we're talking about birth disparities, especially with African American women, I think that we are now entertaining the conversation about years of generational distrust with a lot of healthcare systems. And so I think that we create a safe space for that interaction, not only by having more staff of color, but also just things like our late policy. Midwives, we see our patients regardless if they're late. We see pregnant patients late and we see babies late.
Our whole family is just tied up into community of hope.
Hi, I'm Heidi Murkoff, author of What to Expect When You're Expecting. And you may have heard, moms matter to me a lot. That's why I founded the What to Expect project and why I'm here to support Mayor Bowser's National Maternal and Infant Health Summit. Because every mom should matter. I always say motherhood is the ultimate sisterhood, that no matter where she lives, her cultural, socioeconomic, political profile, the color of her skin, every mom shares a common goal. Every mom wants the best for herself and her baby. But far too many moms, especially Black moms, don't receive the quality, respectful prenatal care they need and deserve. Too many Black moms die of complications of pregnancy and childbirth, and far too many of those deaths are preventable. And the onset of COVID-19 has increased the risk for Black moms. Gaps are widening as clinics and hospitals in rural and urban areas close, and care becomes even less accessible. And more of our most vulnerable moms I speak to every day, are falling through the cracks of care. The truth is we can take care of our moms and control pandemic at the same time. We just have to pick our healthcare priorities, and we have to stop always putting Black moms last, like they don't even matter. One way we can do that by voting. This year, WhatToExpect.com, a home to over 19.6 million moms, and the What to Expect Project have launched #MomTheVote to urge moms to speak up and be heard, to vote for those who vote for them, for maternal health care that doesn't discriminate or come with a use-by date, and that isn't paused because of a pandemic, for paid family leave that allows moms to care for themselves and their babies instead of forcing them back to work after only a week or two, affordable childcare, and so many other policies that impact their lives and their children's futures, and that of their mom sisters. There's no better investment in our future than the health and well-being of our moms. All of our moms, no exceptions, no disparities. Let's stop failing our moms. Let's make moms the priority they should be.
I'm Polly Donaldson, Director of DC's Department of Housing and Community Development, and I wanted to talk about affordable housing in the District of Columbia and our affordability crisis. The rule of thumb is you should only spend about a third of your income on your housing needs. We know we have to do more in the District of Columbia.
Mayor Bowser has been a national leader in affordable housing policies and funding, but she realizes we need to do more. So she challenged the city to produce 36,000 housing units by 2025, with 12,000 affordable to low-income residents. Our first analysis is looking at where affordable housing is across the city and where it should be in the future. This summer, we asked residents to examine a map of affordable housing in the city.
I feel the distribution of affordable housing in the city could be a lot better. It seems too much of it is concentrated east of the river in Ward 7 and 8, and not enough of it in Ward 3. Ward 3 would be a perfect place to have more affordable housing. It's resource rich.
For me, housing and affordable housing is personal. I first got involved in producing affordable housing for our homeless families over 30 years ago. To me, it's all about who is your neighbor, and are we able to say that anybody who wants to be in the district, whether you've been here for 5 generations or for 5 minutes, there is a place for you in the District of Columbia.
Clara is our first child, and we didn't know what to expect being first-time parents. And it's just been such a fun experience to watch her grow. Starting out very early, we monitored Clara's development using the Learn the Signs Act Early checklist. It was just an amazing resource to be able to say, okay, this is what she should be doing at this age. And it calmed our fears a little bit.
I
I would have to say my favorite resource of the Learn the Science Act Early would be the app. But having the app readily available has honestly been great. And it's been awesome just seeing her development and growth. The Learn the Science Act Early app is actually very easy to use. I can access it right there on my phone. And whenever my mind kind of pops to it, I can open it up.
I think I am a Learn the Science Act Early super user. The Learn the Science Act Early materials have been invaluable to me because I feel like they've been there with me throughout parenthood in kind of the way that a wise old friend might be.
Using Learn the Science Act Early has helped me monitor my daughter's development and gives me a great peace of mind that the information is accurate and it's backed by science. It's fun to see when she achieves a milestone. I feel very proud for her and excited.
And it's not just a milestone of, is my child doing this next thing? It's what should I be working with my child next? Because that can be a big question mark as a first-time parent.
You know, I want to know if maybe she's lagging farther behind than she really should, and that's something to bring up with our pediatrician.
Having something at my fingertips to kind of go through it with her physician. She's hitting these milestones, but not these other milestones. Should I be concerned? What kinds of things can I do to bring her up to speed? And then taking that and translating it with her teachers in her classroom to make sure these are the things I would like to focus on, and how can we work together to make sure that she's developing appropriately.
The Learn the Science Act Early resources empower parents to take a stake in tracking their child's developmental milestones.
Just the name itself, I really like it. Jubilee Jumpstart, like you're jumpstarting your kids to a great future. I really enjoy the name.
Come on, everybody.
It's like a community. It's like a family here. When I brought my kids here, I said this will be a place where I will probably keep my kids here for a long time. I'm a student. I'm a single parent. I'm striving to get my degree, and that is a goal that I'm setting in place for myself, and I'm going to get there. I have 2 kids here. My oldest, Cedric, he's been here since he was 5 months. He's now 4. My youngest, Sydney, she has been here since she was 5 months as well, and she is now 22 months. I mean, I struggle like a lot of other parents, but a lot of my difficulties and struggles that I've had since my kids been here, staff have seen it and they've asked, do you need the help? What can we do to help you? And that right there is something that's big for me.
Enrollment means everybody is starting their Jubilee Jumpstart journey. Children go into their classrooms and we almost immediately are talking to parents about their opportunities for engagement, connection, and growth themselves.
There's different parenting groups you can do. To have a group that you can connect with and be open with and share, it was great. We shared different parenting styles, parenting techniques, and that's what helped me.
Jubilee Jumpstart was founded to address the opportunity and achievement gap. We see in our city and our country that children with less opportunity achieve less, and that is generational. So when we want children to get on a path of lifelong learning, they are supported in that by the people around them also participating in lifelong learning.
When he started here in Jubilee Jump, his mind changing like 100%. They helped me to be a better mother, good person, extra good person. Jubilee helped me to feel more comfort about my person, understanding to my son. They helped me a lot.
When you teach at this age, they grasp things like they're sponges. It's just amazing seeing him like grow. Like he loves to teach other people things. He'll show other people things. And it's amazing. And the teachers, I credit the teachers a lot. They are amazing teachers.
Jubilee jumps out as a special place for me because they gave me so much. Courage, wisdom. It was life-changing.
We learn in community and in relationship. And so our little place is a place where community is built, really family is built, that changes the trajectory. Children can do anything if they are given the right launching pad for it.
We don't just own anybody, we welcome whoever comes in, and we give everybody the opportunity to be here.
Nobody seems to get kicked to the side or the curb. If you see someone that's struggling, hey, you need some help? Let me help you. That's the type of community this is. That's the type of center this is. They're there for me.
To those people who help this center, the only I can say is thank you. God bless those guys who donate those money. Thank you. Thank you, thank you, thank you.
There is a major crisis with America's health system. Millions of people, including many with health insurance, are unable to get the care they need. The solution is simple. Having access to reliable, high-quality healthcare is the way to keep people and communities healthy.
That is why 30 years ago, we created Mary Center, because we believe that everyone should have access to the best possible healthcare, regardless of their ability to pay. For us, quality care is not a service, it's a human right.
For Mary Center, quality care goes beyond just medical care. It includes access to the very best in dental, behavioral health services, low-cost pharmaceuticals, education, and social services. We believe healthy people make healthier communities. So we've decided to refresh our look to show that by connecting each person to the best possible care, we will not only improve lives, but we will strengthen communities too, one person at a time. When Mary Center puts care at the core, you can too. To schedule an appointment or find out how you can help, visit our centers or go online at marycenter.org.
This is a vaccination to keep you healthy. You don't want the measles, do you? Here's your sticker.
Protect your loved ones and they'll pass it on. Don't let COVID-19 stop you from protecting your child.
You're next, Mr. Bear. You need a flu shot.
Now more than ever, it's important your child receives their vaccines on time. Brought to you by the District of Columbia Department of Health.
Ah, good. See, it wasn't that bad.
Do you worry your preschooler doesn't walk, talk, draw, or play like other children their age? The Early Stages Center can help. Our friendly staff will assess your child's development through one-on-one, play-based activities. Early Stages will then connect your family with the educational services that are right for you. Everything is free, whether your child is in public school, private school, or are not yet enrolled in school. Call 202-698-8037, a service of the DC Public Schools.
This is a total no judgment zone. We don't want parents to feel like because of X decision that they've made that they've done something the wrong way, because I know how sometimes difficult it is to manage diet and brushing. So it's important to put families at ease, encourage instead of discouraging, and making sure that they know that we are partners in their care, and not those that are there just to wag a finger or judge them about anything that they're doing. To get a call from a parent that that says, I can now breastfeed my child because of you. Maybe they've been told elsewhere they'll never breastfeed their kid, and a simple procedure to do something now changes that whole trajectory for them. Or a child that may have been referred to me and no one can do anything with them, and they come in and I'm going, really? The kid walked in and out smiling, like we had a ball. And we didn't have to do anything like sedation or general anesthesia, which we do pretty often, for them. We didn't even have to do that. A simple, just encouraging, it's gonna be okay, we've got this, we're gonna do it together, let me know what you need. Just kind of thinking about families and thinking about my own family as we make decisions within our practice.
Listen, every day in America, workers are forced to make the unthinkable choice between caring for themselves and loved ones or keeping their job. You know how that can be. Beginning July 1st, 2020, workers in the District of Columbia will be eligible for paid family leave. That's right. When your loved ones need you most, you should be able to step up to the plate and take care of them. That's why DC Paid Family Leave will provide up to 8 weeks of parental leave to bond with a new child, 6 weeks of family leave to care for a sick family member, and 2 weeks of medical leave to care for yourself when facing a serious health condition. Hey, we understand that sometimes life happens, and you shouldn't have to choose between your livelihood and your loved ones. So if you want to learn more about DC Paid Family Leave, check it out at dcpaidfamilyleave.dc.gov.
Complete the 2020 U.S. Census. It is safe and secure. It benefits your city, your community, and your family. When you fill it out, you will help determine where billions of dollars will go, funding our kids' education, school breakfast and lunches, healthcare and Medicaid for our seniors, better social services, creating more affordable housing, job training, and helping everyone have access to food. Complete the census online, over the phone, or once you receive it in the mail. You matter. Get counted. 2020census.gov.
We've been able to really shift our care according to what we feel like the population needs. I think one of the things that makes us strong is that we provide culturally aware care. I think it helps that the majority of our midwives are of color. When we're talking about birth disparities, especially with African American women, I think that we are now entertaining the conversation about years of generational distrust with a lot of healthcare systems. And so I think that we create a safe space for that interaction, not only by having more staff of color, but also just things like our late policy. Midwives, we see our patients regardless if they're late. We see pregnant patients late and we see babies late.
Our whole family is just tied up into community of hope.
Inside Out Dad, supporting incarcerated dads going home. Hosted by Mary Center and DC Health.
All right, I think we're on. Good afternoon, everyone. Welcome to the Inside Out Dad Supporting Incarcerated Dads Going Home presentation. That is a partnership effort from DC Health, Devin, and myself from Mary Center. My name is Felix. I'll be one of the panelists today.
All right, and my name is Devin Anderson, a public health advisor for DC Healthy Start. And yeah, I'm very thankful for the mayor's office that we have the opportunity to discuss this topic.
Yeah. And I should also share with my name is Felix Hernandez. I work with Mary Center, and I am the advocacy and fatherhood supervisor there at the home visiting program. Thank you also to the mayor for the opportunity to present on this subject. All right, let's keep.
Well, again, this workshop will present an overview of the partnership between Mary Center Father-Child Program and the DC Healthy Start Fatherhood Program, and our work with the Inside Out Dad, which supports fathers in transition going home from parish to prison. So we're going to just be hitting on a couple of topics today, discussing healthy masculinity. We're going to introduce you into Inside Out Dad program. Lessons learned while working with returning citizens, the importance of fatherhood in the life course perspective, and identify the need for men's health equity.
Right. Thank you for that. Can you take it to the next slide? Okay, so we wanted to begin with the importance of this work. Why is this important, and why is this work urgent? And so I wanted to share with you all this quote that I think starts to scratch the surface a little bit. There's a time in a boy's life when the sweetness is pounded out of him, and tenderness and the ability to show what he feels is gone. And so this ties into a very important aspect of our work within the Inside Out Dad program, because it talks about handling and showing feelings specifically. It's in one of the sessions that we'll review later on. But what this is beginning to open up a dialogue around is how society implies that boys don't cry, or that when we do see a boy crying, some of the language that some of us might be hearing is that man up. It's either a sign of weakness, or that we punish young boys for beginning to express themselves. And so we are trying. One of the reasons why that we believe that having conversations around healthy masculinity is because of this quote that tries to capture the essence of what might happen in a young boy's life in a society that does not value emotional intelligence for men. So next slide, please.
Mm-hmm.
Yeah, so another important aspect of this, and another thing that makes it urgent, is a quote that Nelson Mandela shared as a person who was incarcerated himself, but we wanted to share with you all as well. And so the quote is, "It is said that no one truly knows a nation until one has been inside its jails. A nation should not be judged by how it treats its highest citizens, but its lowest ones." And just to the side of it, you'll see National Fatherhood Initiative, Father Facts, that 92% of parents in prison are fathers, which I think is an important thing to contribute to this conversation about healthy masculinity, and also the kinds of services and supports that we can provide to men incarcerated.
Yeah, and I think that this is also an important time to really thank some of the people who really we without them it couldn't really be made possible. So the Department of Corrections, the facilitators Kevin Burrell, Jesse Sneed, they manage the participants. They do evaluations, and they come up with a plan that kind of sets them up for success. So, you know, really having them was a very important piece there to going forward with this program.
Before we go on, Devin, I do want to kind of give everybody a chance to know how we ended up in in trying to do the work of having discussions around healthy masculinity with men who were about to be released, returning citizens. So could you share with us how you ended up in doing some of this work?
Yeah. So I've been working with the population for a couple of years with a program called Project Empowerment. That's another group of people. Miss Lane, Miss Upshur, Mr. Lewis, facilitators there, Mr. Gill. For over 15 years, Project Empowerment has helped to reduce economic disparity in the district, serving thousands of individuals with multiple barriers of employment. This program is what allowed us to go into the prisons. I was working there doing weekly classes, health related classes for the Department of Health, and there was a need to really get inside the jails and really talk about certain subjects before their release. A lot of the program participants there, I would say, are 90% male, and mostly coming out of incarceration, and if not, are homeless. So there was a great need to really express fatherhood to this demographic. So along with some of the people who I named, we formed a partnership with Department of Corrections, Department of Employment Services, myself at DC Health, and the Father-Child Program at Mary Centers to work with our returning citizens.
Thanks, man. Like, I also got to say thank you for in inviting the Healthy Start team and the other at Mary Center to support you in this work, because it's how I found my way into doing having healthy masculinity conversations with men who are about to be returning citizens. And so, like, before I was a home visitor, I was a teacher. I was teaching middle school in VA, and I also I really enjoyed the process of teaching, and I've always felt like I was connected to providing services and supports to children who were looking for those kinds of like, just, getting more information on what it is to be healthy. But like, as I became aware in home visiting that there's conversations around increasing the capacity and also increasing the engagement of fathers in this work, I just felt like it was a natural like evolution of getting into supporting families. We should be including fathers, and fathers should be finding ways to engage in providing supports to their families, because it's we are an important contribution to the well-being of a child. And I felt like being able to provide that for returning citizens and trying to connect them with home visiting and all the other programs that exist to support those returning citizens in reducing recidivism, I felt like it was important. And so, like, I gotta say thank you to you. From the beginning of me coming into home visiting, you immediately knew, like, we have someone who might be interested in doing this work, and like, it was a pleasure to get together and collaborate on this front. We also, just real quick, wanted to share some statistics, some information about fathers in general. And so findings from the rapidly growing science of early childhood and brain development show that a father's active participation and emotional engagement with his children leads to improved social, emotional, behavioral, and academic outcomes. Research confirms that a father's emotional engagement, not the amount of time fathers spend with children, leads to multiple positive outcomes in both girls and boys. There was more information, Devin. I don't know if you wanted to share on that one.
Oh no, we're gonna move on and put it on some of the guests we have today. We want to ask, what does the word father mean to you? And if you could just write it in the chat. That would be great. This is just a moment to kind of get interactive with you.
Yeah. We understand that the word father means a lot of different things to a lot of different people. And I know that for fathers themselves, like that's a role that also looks differently across the board. And so we would like to hear some input, feedback about what the word father means to all of you. We'll wait a couple just to see.
A couple of seconds.
Gotcha.
See if we get any hits.
I know that for me, the thing that I really, when it comes to the word father, the definition has grown over time, especially with figuring some of these things out that I think the Inside Out Dad program was able to provide. I think that a father is anybody who's involved in any masculine person involved in the development and care giving towards a child. And that could be a stepfather, that could be a grandparent, that could be an uncle, right? A cousin, anybody who's involved in supporting the child and caregiving to that child, I think is how I would define it. And also there's single mothers out there who have to assume this really important role of parenting that some folks might also find like borrowing to describe, my mother was a father too, like we do make room for how that is also a real answer as well. And so we're going to keep it moving. Thank you all to those who shared. We appreciate that.
Okay, so we're gonna go over our definition of a fatherhood. This is a definition that is provided by National Institute of Children's Health and Quality and the National Healthy Start Association, who has been very helpful. They call them the three Kens, but for those who are involved in fatherhood, they are some of the best who do the work, and they have helped me tremendously. So I appreciate that. So we're going to start off with the first one. I'm sorry, did I?
Yeah, you skipped.
Okay, yeah, sorry. So the state of responsibility of being a father, also a term reference to describe the movement that looks at programs and efforts that focus on fathers and their impact on children's well-being. Fatherhood is the state of embracing being a father/parent. Fatherhood is a practice within family community that is rooted in a commitment to core values, practices, and principles grounded in beliefs that support the growth and nurturance throughout the life course of children. And lastly, fatherhood is a protective factor over children and family given by a man that provides shelter, protection, and a healthy, loving environment in which a child will be nurtured to grow into adulthood.
Thank you very much for reading those answers. Right before I get into that last definition, I also wanted to highlight some of the responses that we had heard for the question as well. So some of the responses for the question of what does the word father mean to you, some of you all had shared that the word means protector, provider, a family backbone, a mentor, a confidant, and an encourager, which I think are really excellent descriptions of what a father can look like, and very, very glad to have received those answers. Thank you all for sharing. We'll also keep it moving if we can. And so like the one thing that I do, before you go to that next slide, there's a definition aspect that I really want to highlight. And so in the phrasing protective factor, I would like to mention that because it's important to know what we mean when we say a protective factor. So protective factors are characteristics associated with a lower likelihood of negative outcomes or that reduce a risk factor's impact in the life of an adult. Protective factors may be seen as positive countering events. And so this language is informed by the Adverse Childhood Experiences study that, let me define that for you all as well. The adverse childhood experiences are traumatic events occurring before age 18 that include all types of abuse and neglect, as well as parental mental illness, substance use, divorce, incarceration, and domestic violence. So when we are talking about protective factors, we're talking about those events or material resources or the involvement of family and community that help reduce those negative impacts of the adverse childhood experiences. Those traumatizing experiences, we understand that it can have a long life impact in health outcomes. And I welcome you all to look up the ACE study so that you can get more information on what this is beginning to scratch the surface on. But one of the things that I would like everyone to carry with them after that is that fatherhood is a protective factor over children and families. And I invite fathers to begin to see how this is a part of our contribution to the upbringing of a child. So yeah, thank you. Next slide.
All right, so we're gonna talk a little bit about the Inside Out Dad, and really what is the Inside Out Dad? This program connects inmate fathers to the families, helping to improve behavior while still incarcerated and to break the cycle of recidivism by developing profiler attitudes, knowledge, and skills along with strategies. And I don't see them on here, but I'm just going to give you. We just went over the definition of a father.
And also, I don't mean to cut you off, Devin. I also want to give a definition for recidivism to those that might not understand the term. So recidivism is the tendency of a convicted criminal to reoffend, to return to the prison system. And so the Inside Out Dad program is working in an effort to reduce or break the cycle of recidivism for individuals by promoting these pro-fathering attitudes, knowledges, and skills. So, all right, yeah, go ahead, Devin.
I thank you for that, sir. So there's 5 characteristics of the Inside Out Dad. Self-awareness, how do I care for myself? Caring for self. I'm sorry, back up. Self-awareness, how well do I know myself? Caring for self. How well do I care for myself? Fathering skills, how well do I father? Parenting skills, how well do I parent? And relationship skills, how well do I partner? So those are the 5 characteristics of the Inside Out Dad, and that is really the main focus of this curriculum. You see? Yeah.
Just real quick, and we understand that we hope that all healthy individuals that coexist alongside men and fathers are also working to be self-aware, caring for self. We also understand that fathering skills is very specific to masculine individuals. We also understand that parenting skills is a shared responsibility, but we also hope that the relationships that we all carry are also working to be positive, constructive aspects of all of our lives. And we welcome men in this work as well. So yeah, go ahead, Devin. My fault. I didn't mean to cut you off like that.
No problem. You know, when you flow with it, so it's okay. So I want to kind of break down some of the sessions on how we came in. There were actually 5 workshops, and we really divided these 12 sessions that you see on the right into those 5 workshops. So like 1, 2, and 3, sessions 1, 2, and 3. Really gives you like an introduction into the program. It goes over those 5 characteristics that we talked about. It dives deep into like the family history, which is important because we see differences in how we're raised, and that's where really the discussion of healthy masculinity really starts, because we're talking about parents who may even discipline their children for crying and for showing emotion. So, we see how when they grow up, it's hard for them to show those emotions. And a lot of times when it comes out as anger. And we also see it in health-wise, because we're always told to, dust yourself off. Oh, that doesn't hurt. Don't cry. Be a man. And that how that kind of develops into this not going into the doctor and things of that sort. And and session 3 talks about what it means to be a man, and those factors, and maybe some of the experiences that they went through. Sessions 4, 5, and 6, showing and handling feelings. That also goes into men's health, which we not only talk about physical health, but we talk about mental health. It gives a chance for the participants to grade themselves. We have questions 1 to 5. How do you rank your health, your physical health? And then we'll ask 1 to 5. How do you rank your mental health? So it gives them a chance to kind of grade themselves. And following from the inside is really a good segue into communication, which is session 7, because we want to build some communication while inside of the prison. Sometimes fathers are ashamed of the situation. Sometimes they're a little bit closed in or shut out, and they stop that communication to the family and to their children. So we want to get that back running, make sure that they're fathering from the inside, that they know what's going on outside, and that helps with the communication aspect. And also we have the father's role, children's growth, which deals with different milestones and things of that sort, protective factors. Session 10, discipline versus punishment. A lot of times we are used to punishing. We're used to punishing, and there's no discipline. There's no it's just like a effect without no cause. So we talk about discipline and what it means to discipline, and how it is different from punishment. And numbers 11 and 12, working with mom and co-parenting, just really being able to kind of stand in the mother's shoes and really know some of the things that are going on with her, that maybe once. So some of the reasons why you're getting some of those reactions or negative reactions from her. So just kind of standing in the mother's shoes and changing impact, graduating from the inside out dad and just going over the other 11 sessions, basically a recap, so that we can take that outside with us and have a positive impact in the community.
And we, in each of these sessions, we also ran through activities, we did discussions, we had open forums where we wanted to create a safe space so that people could ask the questions, and also present some of the ways that they've been disciplining, for example, that some folks have to defend because they want to defend the way that they parent and they discipline, and also other suggestions that some of their colleagues and peers were able to share in the group. It was a really great opportunity for us to begin to look at the more abstract and how it applies to the individual life and the choices that we make as men. And there's a couple of really good sessions and examples that I felt captured some of this, and I'll try and really quickly go over just one activity with you, Devin, if that's cool with you. So let's go to session 4, for example, and we're talking about showing and handling feelings, right? And one of the activities is one of the demonstrations and activities is that we understand that emotions can have can build up tension in the body, but this is how we're going to go for it. So Devin, can you talk about, let's say, give me 3 emotions that you experience that are hard to show and or hard to handle?
Okay, so I'll say sadness.
Okay.
Sadness, anger.
Okay.
And grief. I'll say grief. Sadness, anger, and grief.
All right, so we have sadness, anger, and grief, and imagine that they're written out in front of you on little note cards, right? We have grief. You might not be able to see it because of the light, but anger and sadness. Okay, so Devin, imagine that you wake up fresh. nothing is interrupted. Your mood, you got your coffee, the day's like sunlight, like picture perfect morning, right? But you get a phone call, you get a text, and something makes you feel immediately like just sad, right? But your name is Devin Anderson. You got to keep it moving. Your day doesn't stop at sadness, right? And so you gotta, you just gotta ball it up and put it in your left hand. So now you're holding sadness in your left hand, right? But you still got to keep it moving. So you got your cup of coffee, and you're holding sadness in the left, and you're out the door. And then out of nowhere, someone cuts you off. You're driving to work, someone cuts you off, and it makes you angry. Mm-hmm. But Devin Anderson got to keep moving. He got to drive it, so he can drive like this, right? Closed fist, tense, but he can get himself to work. There's no real interruption. But let's say like right around lunchtime, you start talking to an aunt, and she drops some really heavy news on you, and immediately you start to develop some grief. And so you just felt sad in the morning, right? But you couldn't stop and deal with it, so you had to keep it moving. And now you're holding anger because somebody cut you off, and they cut off Devin Anderson in the middle of what he was doing, and so like that's upsetting. But now you had to receive this like grieving news, and what do you do with it? So now like this is weight that's in your shoe, and so you're dragging your left leg because grief is in your shoe. You're holding anger on the right hand. You're holding sadness in the left hand, and here you have an example of how emotions, if not handled or if not given the room to be felt, you won't be able to release them. Mm-hmm. You won't be able to keep yourself moving forward without that opportunity to address these emotions. And so, Devin Anderson has his techniques to take care of himself. And so he recognized that maybe he needed to take a step back here, because he could not continue to pick up emotions and not handle and not deal with them, rather. And so this is just one of those examples of how, like, in the sessions, we demonstrate that handling emotions is not only our responsibility, but it's also a need. We have to take care of ourselves. And in order to do that, we have to make room for these things. And so this is just one example of many that's present in the Inside Out Dad program. Go ahead.
I know in the same session, and we're not going to take long with this slide, but we talk about like people, and sometimes it's the people that we most love. They know our triggers. They know. So I normally, we can't bring a lot of stuff into the prison, no phones, no laptops, no anything like that. So I always get a pen, and I say, we can't let people control us like remote controls. So sometimes the example, I will go to a participant and say, mad, sad, angry, and it's really the other person who's controlling your emotion, and everything else is reactionary. We kind of go through, hey, if somebody spits on you, what you gonna do? What's you gonna do? And sometimes, a lot of times, it's reactionary. I'm gonna hit him. I'm gonna do this. But he knew that he was gonna get that reaction out of you, and that's why he did it. And at the end of the day, you're gonna be back in the same situation. So we can't let people control us like that.
And I also think that it's important for men to begin to understand what triggers them into some of this really negative behavior, really destructive behavior. We want to make sure that we also hold men accountable for if something is triggering to you, there's work that needs to be done to understand what those triggers are, and also work to be done to change behavior if it's negative and it's causing harm. And it's very real effort to invite men and to be vulnerable. The whole process of going through Inside Out Dad is also like an invitation to like practice what it is to be transparent, honest, and vulnerable. We do have some questions, and so we'll keep it moving. We'll hold questions for the end. But I like this question that we're gonna address a little later. So let's keep it moving, Devin. Thank you. And so Inside Out Dad in practice. Inside Out Dad gave us the opportunity to approach the work of discussing masculinity from the good, the bad, and the unspoken, to give participants the chance to engage in reflective conversations that support their growth and well-being as fathers and as men.
Right. So it is ideal for men who get out of prison or jail to become successful, contributing member of society, giving incarcerated fathers a vision that they have a unique and irreplaceable role in the life of their children, along with increased confidence and changes in attitude and about their situations in their family that really help in successful reentry. I know that for the most part, we had a lot of great sessions, but the most popular session was the one that we just went over a little bit, was showing and handling feelings. And again, it gives participants that chance to have the conversation about subjects they often do not discuss. Matter of fact, one of the most important questions I think that was asked was, what is the one thing that you never grieved? Like, what is the one thing in life that you never got over, that you never addressed, that you never grieved? And the answers of some of the participants, I never really, got a chance to grieve about my mother passing, or it was so many great opportunities for them to share. And just like Felix was saying, it's just that flow that they're able to really talk about things that they don't normally talk about. So I thought that was very good.
No, I appreciate you reminding us about that, because I recognize that a large part of the influence as to why men aren't open has a lot to do with the culture of masculinity, like the patriarchy, right? I also recognize that there is work that still needs to be done to make spaces feel safe enough so that men can talk about these emotions and these feelings. And it is a responsibility of the masculine to push that forward in creating and making sure that when we see a child that's crying, we validate that. We say, it is okay to cry. Men cry, but we're still like human beings, and we all feel these emotions, and we have to make room for them. And I think it's incredible that in question, like, they see it in written, that they can respond to, that they can write their answers to in their workbooks, about what is the one thing you haven't been able to grieve. Mm-hmm. That's such a great example, Devin, and thank you for like sharing that with everyone here. Like there's work that still needs to be done when it comes to fathers, and there's work that still needs to be done when it comes to engaging men and masculine individuals. But there's amazing work that can be done in just having these conversations. And I'm really grateful for the opportunity to have Inside Out Dad be the vehicle for this.
Right. And because of time, I don't want to go too deep into it, but fatherhood.gov has some great information on fatherhood curriculums. They also have some resources about some reports from the Maryland and Ohio prisons that did Inside Out Dad, and Rutgers University that also practices the Inside Out Dad program. So fatherhood.gov has a lot of information that may be helpful.
All right, cool. Let's take it on to the next slide. And real quick, so this is a quote that one of the fathers that was involved in the cohorts inside the Department of Corrections, that later got involved with home visiting programs at Mary Center, and they testified at this year's fiscal 2021 year budget oversight hearing. And so I wanted to share a quote, and we'll have other quotes to share as well, but this was one that I felt really struck the note for this work. The support and help that help those team members provided in the jail and outside the jail is incredible. Now I'm in my own apartment with my children, and the relationship with my other two boys is picking up. This is like a quick snapshot of like how we can truly begin to support fathers inside the jail systems, outside the jail systems as well, so that they can recognize that the impact that they have in the life of their children is lifelong and can be positive and constructive. And I do believe that one of the urgent in the urgent and significant, the significance of this work is we want to show and demonstrate to fathers and men that our contributions to the well-being of our children and the nurturing and growth of our children is significant and important. You also had some other quotes you wanted to share here, Devin, real quick.
Absolutely. There's just a few comments from other participants. I really enjoyed a lot of the dialogue and issues we discussed in this group. The group helped open my mind to a lot of things as far as parenting styles and how to go forward with teaching kids new things. And I have another father who said, I learned to be a better father. I learned that you have to put in work to be a father. I think that was a good one. So yeah, it was a lot of positive. It was a lot of positive reaction from the guys, and I just want to make a point that I feel like one of the ways that this worked was because of the Project Empowerment Program, and that since I was doing weekly presentations at the Project Empowerment Program, when the guys came out of the facility, they seen me every week outside of the jail at the Project Empowerment, and just being able to talk to them, make sure that they were okay, make sure that they wasn't stressing about anything, did they need any help, did I need to refer them to Felix at Mary Center. It was just good that I could see them outside of the prison and really just be able to check up on them.
Next slide here. We couldn't talk about the great aspect of the work without also mentioning the barriers, right? What are we encountering in the lives of the participants that is counter to like a group of 3 men, which was myself, Devin, and Oliani, to come to them to talk about fathering masculinity. And so we'll hit that first question, the first barrier rather, last, but I know I'll start with the one after that. So one of the barriers that we heard often was, I don't need anybody telling me how to raise my child, right? Like everybody has a right to parent and discipline however they see it fit. There's also like a cultural elements about parenting that we have to consider. And we as supporters of families have to go in with humility, have to go in with that understanding that we are not there to tell anybody how to, how to do what they do, right? What we are hoping to bring to them is options, new ways of thinking, opportunities that they might be missing because parenting is difficult. And we want to make some of that stress less. We want to support those families in those individuals in just seeing that parenting is a unique opportunity to be the world's best teacher right there for your child. And I'm gonna share this with you, Devin, because I know you got some good points to share as well.
Yes, sir. So I'll just go through some of the rest before I go into that. What are ways men could be more involved during pregnancy? And they're asking this because they don't feel involved. They go to a doctor's office. There's hardly any representation, any magazines, any books, any pictures of men, or even pictures of men with their families. So there's a lot to be said about that, about really making men feel comfortable about that space. And if they could really feel comfortable about being in a doctor's office, then we would really see them more when it comes to some of these prenatal visits and things of that sort. They ask about barriers to like seeing their child, and how the mom could be a gatekeeper is what it's called. When they gatekeeper is when a father is trying to see his child, and the mother is not letting him for whatever reason. We went through some things. Not some things, but some conflicts when it comes to can a woman raise a man? And really, we just there's actually a activity in the curriculum where we will write father on one end, put a line, both in the middle, and on the right it'll have mother. and then we'll say whose job is it to nurture? Whose job is it to nurture the child? And a lot of people, oh, the mother, that's the mother's child, she nurtures. And then, like, hold up, some guys are like, hold on, no, I nurture my child. We nurture too. So we see a lot of times whatever subject it is, whatever protective factor it is, it's both parents' job. So it's not a mother can't do this, a father can't do this. It's really both. And so really breaking down that myth is really effective to kind of starting off new and saying, hey, just give them a new perspective in that.
Absolutely.
Yeah. But I wanted to highlight how can you teach us about fatherhood if you're not a father? I thought that was very interesting, because it was one of the first questions that was asked to us, and it kind of threw us off, because me and Felix wasn't a father at the time, so it was like we kind of fell back on our training and our experience. Both of us have, correct me if I'm wrong, like 10 or more years of experience doing this fatherhood work. But luckily, we did have a father on staff with Oleani Mendez, and he was able to kind of
bridge that gap.
To kind of bridge that gap, because at first it was like it was a great question. I think it was a great question. But later on, and one of the things I wanted to highlight is because I ended up. Me and my wife ended up, she ended up getting pregnant, and then it was then where I could finally say, boom, I'm in there, I'm in there. So if anybody asks, hey, how can you teach me if you don't got a child? I'm like, hey, well, I'm a father, and hopefully we can share stories, and we can work to kind of teach each other how to do this. And it was a beautiful thing going through that, that process of, with those guys. And just just getting feedback from them, me telling some of my stories, and just really it really was about building community and caring for each other and making sure that we're all in a position to succeed. So I thought that was great.
All right, cool. So real quick, Devin, we're gonna have to keep it moving real quick, just because we are trying to get the questions and we want to leave enough time.
Yep.
So.
Oh yeah, I got it. I'm gonna do this real quick. So, you see this guy in the black in the middle, and all arrows are towards these subjects: preconception, pregnancy, birth outcomes, postpartum, and parenting. So a lot of times when we think about preconception and interconception, we think about the mother, but there's been a lot of findings that fathers need to do some things before, sometimes months before pregnancy, lower their stress, stop any smoking, stop any drinking. These are very important for really to get that head start in actually preconception. So this is how we start with men's health, is making sure that your temple that is clean, that is healthy, and that we're actually planning, and we're getting back to planning to have this baby. And the same thing with interconception. After a baby, you have to wait a certain amount of months, 18 months after the next pregnancy. So how are we going to do that? We're going to have we're going to use protection? Is it going to have birth control? It's going to, I think sometimes this is the question that we give just the mother, right. that one question, but it's for both parents to really talk about and really plan the pregnancy. And so during pregnancy, the father has to be there. The father has to be present. That is the most important part, is that the role of a man during pregnancy is to support, to understand, be patient, and have sympathy to the woman carrying a child. But we see that even when it comes to things like the doulas, I've heard a couple of dads say that the doulas kind of are taking their place in the whole birthing aspect. But the doulas, I know in my experience and what I shared with my participants is they had so much information for me about the birthing process. I mean, it was just, I don't think I could have been more prepared, to what was going on, different situations. They go through every possible situation and come up with a plan. And the fathers, really have to be present for that. I think it's very important that they get that education that both, whether they're together or not, you want both the parents to have the same level, if not more, education, so that there's no lag when the child is in the father's presence. There's no lag in the services. So even there was a study. A study in 2008 that showed that actually mothers who had both the father and the doula actually had better success than with just the mother and the doula alone. So again, the father is very important. Postpartum is just like the pregnancy. The role of a man during postpartum is to support, to understand, be patient, and to provide emotional, physical, and possible financial support with the mother, because she's recovering from the birthing procedure. Lack of support results in a higher percentage of postpartum depression, SIDS, and potential risk of injury. So we have to be there after that procedure. We have to be there to have a lend a helping hand, chores and everything else. And last but not least, which is going to kind of be a segue into the next slide, is parenting. Healthy parenting is one which involves both mothers and fathers taking active participation in a child's life. So we have to make sure that the father is healthy, and that the father is lasting in the whole lifespan of the child. So a lot of times, we see that the mothers are living longer than the fathers, and that's because they have less risky behaviors, and they're going to those appointments and things of that sort. Was there anything else?
No, I'm gonna have you keep it moving, and then I'll jump right in. And if I can, just real quickly, just when it comes to men's health and when it comes to some of the statistics, we recognize that men are a positive contribution when involved in the life of their child, in birth outcomes, in healthy perinatal women's health. And we also recognize that men at large are dying at increased rates than their women counterparts. And so we want to highlight that a part of this work in having conversations around healthy masculinity, around recognizing the protective factors, and also recognizing that there's work in having to address some of the ACEs or the adverse childhood experiences. We want to support men in being able to take care of themselves so that they can show up in the lives of their spouses, parents, mothers of their children, in the lives of their children in healthier ways, so that they can make it to the elderly side of life, and so that they can also be contributions in that way. We want to share some of this data with you all, but we can't go into all of the specifics because we do want to leave some room for questions. And so if you could, Devin, just skip over this one. Yep.
Mm-hmm. So, hopefully we were able to kind of hit on all the objectives today. We just have one last fact. Just the facts involved: dads improve their children's overall emotional and social well-being. And if you look at if you remember that slide with the life course perspective, with the preconception, the pregnancy, the birth outcomes, and everything. A lot of times, these guys who are incarcerated, they skip over all of that, and they go into parenting, and we know that they could get some drawback from that from both the mother and the child and the family members sometimes. So we kind of we kind of prepare, the fathers who are incarcerated to kind of handle some of those difficulties, and to learn how to discuss it and communicate it without really it breaking out into any type of fight or anything like that. But yeah, this discussing healthy masculinity. Introducing the Inside Out Dad program, lessons learned with returning citizens, and importance of fatherhood and life course perspective, and identifying the need for men's health equity. And anything else, Felix, before we take questions?
And just this is more across the board. Fathers and men, we can't do it alone. We must recognize the importance of mothers and others in our communities that support us and our children. And I invite all of you to support the work of expanding the conversation about healthy masculinity. And also, men, we welcome you into the work as well. This work is lifelong, and I believe in it. And appreciate everyone being able to make it for this session. We do have a couple questions that we wanted to get a chance to answer. So let me see. Oh, can you go to the next slide so people have our contact info? Yeah. Excellent. Thank you, Devin. So the first question, Devin, what impact has probation and parole has on families? This one I am not as informed about. Do you have any awareness or understanding?
I'm sorry, could you say it one more time? I didn't hear.
What impact does probation and parole have on families?
I believe I'm just going off of how what the participants say. I think that they're that is very important, that they understand, about that. I feel like it's an issue with the parole and the participants, and really those services, because sometimes a participant may actually find a job, but they can't work certain hours because of the parole, or right. they have a parole hearing, or they have to meet up with the parole officer, but they got to work at the same time. So it's like sometimes they're like, oh well, let me get this money and I'll worry about me getting in trouble later, and that sometimes brings them back into prison. So I feel like that there can be some changes made when it comes to parole, and I'm not going to say that it doesn't set them up for success. I know not all are the same, and not all experiences are the same.
Right.
That we do need to focus more on really giving them the support to be successful.
Appreciate that. This next question is, have you observed any long-term impact of your programming? And what indicators do you use to capture this? There's measurable data that the fatherhood.org, where we get the Inside Out Dad program, that really goes into demonstrating the reduction in recidivism in returning citizens. Like once some of these programs are fully implemented and with fidelity, we get to see more engaged fathers, and more engaged fathers are less likely to return to criminal behavior to make ends meet. And so, but one of the biggest indicators to me about the success of this program is when I'm in the middle of just like a grocery trip, and I see one of the men that was in the cohorts just stopped me in the middle of like me getting my food, and he's like, "Hey man, look, I don't know if you remember me, but I was in that fatherhood chat sessions inside the DLC, and I just, like it was a good thing that y'all came in and spoke to us about these things. It was really important." And there's nothing, if that's not proof that this works, that the man isn't back in the prison system, is not in criminal behavior. He caught me in the middle of my day, and he made the time to say, like, "Hey, look, I appreciate this, and I appreciate the work that y'all did." I think that speaks volumes for the success of this. And like we know that the work isn't done. We still want to go back in and make sure that these services are fully implemented and are expanded and is accessible to anybody who's interested in this work. We got a couple more questions. We got a couple left. If you have more, please send them in. You can also reach us on our contact info if you have more. There's a third question right here. It is, how can the mental health of dads and men be supported? And I think that this goes into both of us, but I'm gonna let you go ahead on that one.
Okay. How can the mental health of fathers be supported?
Yeah. Dads and men.
Oh, okay. Dads and men. I think that a lot of times they just need opportunity and just having more activities and workshops and things for men. Group settings. One thing that I didn't go into is that I told you that my wife did get pregnant during me facilitating this program, but our son didn't make it. So just kind of going through that and talking to the participants and realizing that there are some issues when it comes to like mental health and when it comes to like actual therapy. I know me and my wife couldn't get therapy together from the hospital. We had to do separate sessions and I think that just more opportunities for men and boys to get that type of work and group workshops and things like that. I think that it's kind of like, if you build it, they will come.
Right.
They gotta have that. They gotta have that there for them. They gotta have that opportunity.
All right, I think we have enough time to do one more. Thank you for that. The next one would be, and I think this is a great question. What can the general community do to support dads coming home? Man, I think that there's a stigma that returning citizens have to overcome in order to re-enter society. There's always the barrier of putting an application forward and not being called back or not being considered because you have a record. And some of these things are potential contributions to why recidivism is such an issue in the first place. And I think it's what can the general community do? I think we need to listen to each other. I think we need to make room for the impact that it has, and also recognize that there's real repair that some of the men have to do in order to re-enter society. And so we're hoping that the time away from society that in prison is in service to the repairing that they have to do, but it also means that those returning fathers have to repair and rebuild relationships with their children, have to repair and rebuild relationships with their families, and families have to be open to that. And that's a hard process. Sometimes that can be done, like as a family. Sometimes you might need therapy, like Devin suggested. But I think it is just as we want men, and just as men should be vulnerable so that they can be honest and transparent about these things, the environment has to do that. And we also recognize that this is a patriarchal system, and that there's things that we have to do in order to dismantle some of these societal pressures to tell boys not to cry. And so truly, it's a great question, and I think the work is also multifaceted. There's always someone that comes in that's going to tell us like what we need to do. And I think in specifically, if there is anything to take away from this answer, is we should be listening to returning citizens on how we bring them back into the community. We also need to make room for that repair and rebuild that needs to happen amongst that community. And so I think that's like one of the ways forward. And I don't know if we have time for one more. There's one more question out here that I think we can make time for.
Let's do it until they cut us off, I guess.
No. I think we got to wrap up. Yeah, we got to wrap up. Thank you all for coming. We really enjoyed talking about the process of doing Inside Out work with the Department of Corrections in partnership with DC Health and all those institutions that really supported us and were a backbone to the work that we did. Truly, it was a pleasure. If you have any questions, if you want to reach out to one of us, our contact info is right there. And Devin, I don't know if you have any last words, man. Go for it.
Just again, thanks to Mayor Bowser and her team for just allowing us to share our input and just the subject of fatherhood in general. I think it's great. This is the second year that I really noticed a fatherhood presence at this summit. So I really thank her for that, and we definitely appreciate it.
All right, thank you all. Take care.
Please welcome back Dr. Faith Gibson Hubbard, Executive Director of Thrive by Five.
Good afternoon, and thank you for joining us today for these phenomenal sessions. I know from the beginning with my colleague Gail Cohn and Age Friendly DC and talking about the role of grandparents, and then actually crying during the session of Sister Friends, thinking about how important my sister friends have been to me in this journey of motherhood and just of being a woman. And then the last two sessions, which really focused on fatherhood. And I know we can all relate to either the positive thoughts we have about our fathers or the ones that are not so positive, the great opportunities. But I was definitely struck by both conversations, as my husband has played a huge role in not only supporting me as a mom, but just the phenomenal example that he is to our children. So shout out to my husband, Drew, and all the great things that he does for our family. But I want to just thank you again for joining us today. We have had some great sessions and some very vulnerable participants who have allowed us to go along this journey with them, not only for us to learn, but for us to learn along with them. I do hope that you will stick with us for just one more day, as we have some really great, thoughtful, insightful conversations coming up tomorrow. We'll start again at 10 a.m. tomorrow morning, and we hope that you will join us either through Facebook or through YouTube or through the Hoover app. There are so many ways for you to engage and continue to network and engage with each other. So again, thank you for joining us today for the breakout sessions today. We look forward to seeing you again tomorrow for more breakout sessions. And again, thank you, and I'll see you tomorrow.